So good morning. My name is Vish Viswanath. I'm Professor of Health Communications here at Harvard Chan School of Public Health and Professor of Population Sciences at the Dana-Farber Cancer Institute. More germane, I'm the director for the Lee Kum-Shung Center for Health and Happiness at Harvard Chan School of Public Health. We are delighted to see all of you here today on a wonderful fall morning, somewhat windy though, but sunny, bright. Sometimes I'm scared, with this kind of weather at this point in time in November, but I guess we'll all survive, That's why we talk resilience through adversity, So what the agenda? I think you all have the agenda. So we'll start with welcoming remarks from Dean Kim. I will introduce her in a second here, followed by, you're struck with me, I'll tell you why we are organizing this symposium at this time for a few minutes. And then I know you're not here to listen to me, but you're here to hear Dr. Williams, who will follow me. But as I do this, so let me introduce Dean Kim. There is this technical information about her, and anybody can get it on the bio on the school's website. She's a dean for academic affairs at the School of Public Health and Katie Lee Professor of Health Economics in the Department of Health Policy and Management and the Center for Health Decision Science. Dr. Kim's research focuses on the development and application of mathematical modeling methods to evaluate health policy issues with a strong interest in women's health. Actually, I'm more excited about Dean Kim's work. She's a great leader. She has been a phenomenal leader of the school. Did a great job as our interim dean time ago, and she's just amazing. I always go to her with complaints. She hasn't scolded me yet and threw me out of her office. Not yet. And this is public pressure on you not to do that, But what you don't know if you don't follow her work is an incredible work on modeling, which the precision of the work is only matched by the lives it has saved globally. I got familiar with your work when I was the Associate Director for Behavioral Research Program at the National Cancer Institute, where we were funding CISNET and other groups. And Jane's work has made substantial differences in lives of people. Both in a number of countries, they have used her models now with WHO. So with all her accomplishments as a researcher, as a leader, I think one of the greatest accomplishments, I think, is really the number of lives you have saved with your work. I always tease her, I should take her to India to do some of that work and talk about her HPV modeling work. One of these days we'll do that. But I want to, she has been a great supporter of the center. We have had some challenges, and Jane stepped forward to help me out in a number of ways. And I couldn't think of a better person to welcome all of you. Thank you.
So Vish, you should know that I can publicly scold you if I go after you in the opening remarks. So, and then you're following me. Okay, fair. Good morning, everyone. And, I wanted to send regards from Dean Beccarelli, who couldn't be here this morning, but he will be joining later this afternoon. So I hope you stick around. So I am here to welcome you on behalf of the Dean and also the Harvard T.H. Chan School of Public Health to this important inaugural Chester Pierce Symposium that's organized by the Lee Kum-Shung Center for Health and Happiness. The center was established in 2016 and is funded through the initiative and generosity of the Lee Kum Kee family of Hong Kong. And since its inception, the center has represented a unique opportunity to rigorously explore the interplay between positive well-being and physical, psychological, and social health, employing diverse empirical methods and a careful consideration of measurement issues. Moreover, it focuses on developing practical applications of the science to inform practice and policy. The center has served as an outstanding platform to redefine what health truly means, beyond merely the absence of disease, and to explore how psychological, social, and physical well-being are deeply interconnected. In addition to advancing scientific understanding, the center has been a leader in training emerging scholars in the area to build capacity for research and translation, which is a core mission of the school. Key programs supporting efforts in this direction include the center's summer internship program, the Innovations in Positive Health Seed Grant Program, and the Dissertation Research Awards. Some of the center's notable translational efforts include the launch of the Frontiers of Health and Happiness podcast, which delves into the latest research on positive health and happiness. Another major achievement was the inaugural Lugano Health Forum this past June. This is a carbon neutral event co-hosted by the Lee Kumshung Center, the IBSA Foundation for Scientific Research, and the city of Lugano in Switzerland. This forum drew over 500 participants and featured 22 renowned speakers exploring the science and practices about human happiness. Through pioneering efforts such as these, the center continues to bring together members of the Harvard community and scientists from around the globe to pursue activities that deepen our understanding of the physical, social, and psychological dimensions of health and happiness. As part of the center's goals to explore these connections and share insights with the broader communities, today we're gathered here for the inaugural Chester Pierce Symposium. The symposium has been established to honor the legacy of Dr. Chester Pierce, a pioneering advocate for mental health and civil rights, whose contributions continue to shape the fields of psychiatry, social justice, and positive well-being. Dr. Pierce served on the faculty at the Harvard Chan School for 14 years in what had been known as the Department of Health and Social Behavior and is now called the Department of Social and Behavioral Sciences. Through this annual event, we aim to celebrate Dr. Pierce's remarkable vision and advance conversations about well-being, resilience, and health equity. At a time when the world is facing increasing social, political, and environmental challenges, it's more important now than ever on focusing on how individuals, institutions, and communities can foster resilience and promote well-being. The symposium provides a valuable platform for these discussions and offers an opportunity to highlight key strategies for navigating adversity. The Chester Pierce Symposium not only reflects Dr. Pierce's lifelong commitment to addressing health disparities, but also embodies the mission of the Lee Kumshung Center to explore how positive health, both individually and collectively, can be fostered through innovative research, leadership, and community collaboration. Collectively, the center's research, capacity building, and translational efforts reflect and advance its far-reaching goals to shift the paradigm in public health from a deficit-oriented lens to one that focuses on positive health outcomes and the assets that promote them. With the new insights from the center we'll continue to develop in times to come, the potential for impact is promising and far-reaching. I'm confident today will be a day filled with valuable learning, new insights, and engaging discussions with our distinguished keynote speaker, panelists, and moderators. So once again, I extend my warm welcome to you all, and thank you so much for being here for this inaugural symposium. Thank you.
Thank you, Jane. Thanks so much for those remarks. I think Jane has already begun this, but if you're running a Center for Health and Happiness, one of the things to remember is the sense of gratitude. So I'll start with that, with gratitude. So we are, as Jane rightly said, we are extremely grateful to the Lee family for their benevolence and in funding the center It's such a graceful family who are deeply interested in what we do here. I just met them, I think 2-3 weeks ago in Hong Kong. And they were just delighted with all the things we were doing. Had a number of suggestions. We really engaged, had a great conversation with them. They're very supportive of what we are doing, and we are always grateful to them for that. I should also thank the school leadership, as I already mentioned, Jane's support and Dean Beccarelli's support. In fact, he will be here in this afternoon. The school has been very helpful in navigating through issues. It's not easy running a center like this. And I ran a bunch of them, so I know how it is. So and as I mentioned, Jane's been a great supporter in helping me making the right, giving me the good advice and the calls, and the other people in the school who have been very helpful to us, staff in the school. I should also thank our department leadership, Doctors Bryn Austin and Karen Emmons, who couldn't be here. They're out of town today. But Karen and Bryn send their greetings to you, and they are there for me whenever I needed them, for help and advice. And last, not last, but I should also thank the speakers and the panelists who have come from different parts of the country and locally to be a part of the session. I'll say a little bit about them and why we selected them a little later, but I do want to thank them for joining us today. And last, and as the cliche goes, definitely not the least, is my team. It's incredible. I think Anubha, I don't know where they are. They're all over. Karina, Ayla, some of them are behind, and the students who they have been working day and night for months. Whenever you organize an event like this, it's not easy. People come, people go, people drop out, people join, and there are all kinds of issues that come up. But they have been working so hard to ensure that things go smoothly as they can. And none of this could have happened without their help and contributions and hard work. As I say, they have been working 24/7 over the last few months. So they deserve a big round of applause, so for all the work they do. So thank you so much. They do the work and then they put me up in front of people, so okay, so there's the key, they handle. Okay, you're supposed to do this. They have a detailed agenda, including saying how do I adjust my mic, etc., because they don't trust me. So if I screw up, it's my fault, not their fault, right? Actually, heck, it's their fault. They should have written that. Anyway, seriously, thank you so much for all the work. You mean a lot to me and all the work you do. When I suggested this topic many months ago, I was thinking of more global trends when I thought of adversity and why resilience matters. I couldn't think of a more appropriate theme this week. Irrespective of your politics, we need to really think through what it means to be resilient at a time like this. And there is no single definition of resilience. If you ask academics, as we say in India, if there are 5 Indians, there are 7 political parties, so you talked right, so you take resilience, you talk to 5 academics, there are 7 definitions of resilience. There are these technical definitions of resilience, and then there are, the day-to-day understanding, common sense understanding of what resilience means. At its basic meaning, it's an absence of negative outcomes among people, especially the vulnerable. But different people have offered different definitions. Some have talked about resilience as bouncing back from adversity as one definition. Others have talked about, systems capacity and capability from coming back, in resisting and building and surviving through adversity at a system level. The cultural meanings of resilience vary depending upon the work of some anthropologists, and some have even talked about how resilience is about keeping moving forward despite day-to-day adversarial conditions. In fact, one author even talked about you keep on ticking, even after taking the licking, right? That Timex commercial that people talk, some people must have seen, right? So there are these multiple definitions out there of what resilience means. And I think, in that sense, there's not one single way of characterizing it. But the important point is that resilience is not just an individual trait, as some people have talked about and argued about. And there have been a number of studies focusing on that individual trait. But I'm going to betray my own biases in talking about resilience as a dynamic process, depending upon over a longer period of time, maybe lifespan, depending on social conditions and social circumstances. And I think this is something that is somewhat widely accepted by many people. How social conditions, social support, social infrastructure could potentially help in mitigating these adversarial conditions that people face and help them bounce back and be resilient or even be resistant to adversities of some kind or other. So I think at a time like this, today, this week, understanding the social conditions and factors and the enormous role they have to play in building, maintaining, reinforcing resilience, I think is an important consideration for all of us. So the symposium, the reason we organize this workshop is not to just discuss the problem of adversity. Of course, adversity is all around us, particularly given the conditions we are facing. Whatever the conditions are, whether it is climate change, whether it is racism, whether it is politics, especially the small p or the big P, politics, migration, forced migration, all these issues, the challenges faced by, adverse human rights conditions. My colleague Mary is here, is a leader in studying this. I think it's not that these circumstances do not exist, but and we will talk about those problems. But today is also about solutions. Today is also about guidance on what we can do. Today is also about empowerment. What can we do as a group, as a society, to foster resilience and reinforce resilience, right? So as Jen earlier said, we want to go beyond individuals, just, and to really focusing on larger systems, larger conditions in understanding and fostering resilience. And that's one of the rationale in selecting today's speakers. We have included a group of people who are doing great research, but we also are bringing in people who are activists and practitioners who have started and running organizations which actually do something about these conditions. And so it's all about empowerment. So we just didn't want to discuss academic part today, but also, and this week we do need that sense of empowerment and exemplars of what we can do in during adverse conditions. So what we want to do is, and the speakers today, so I want to thank you for coming and sharing your ideas, are real excellent exemplars have engaged in exactly the kinds of practices that can foster resilience. So we want to provide a safe space today for a civic and civilized conversations. I'm sure we have disagreements, we look at things differently, but let us hope, I hope that we will have a decent civil conversation around these issues, share some lessons learned from the practitioners and advocates today and the researchers, and networking. And also, please feel free to get to know other people who are in the same space in one way or other. So that's the whole idea in organizing this workshop, particularly in the name of Dr. Chester Pierce, who represents and exemplifies some of these things we are talking about. So I hope you all people will come in and go throughout the day, but I hope you get a chance to meet everybody and talk to everyone. And I'm getting very nasty signals from out there. Okay, done. Okay, so I was going to wrap up anyway. So seriously, so I hope you all have a great day. Throughout the conference today. So next, I know you're not here to listen to me, so I want to introduce Dr. David Williams. I don't know what to say about Dr. Williams. Again, I can do the technical introduction. Anybody can read the bio on the website. He's a professor of public health, the Norman Professor of Public Health at the Harvard T.H. Chan School of Public Health. He's also a professor of African and African American Studies and Sociology at Harvard, and previously a faculty member at Yale University and another university that will remain unmentioned in this conversation. And David knows what I'm talking about. So he's an author of University of Michigan. So I went to Ohio State. He's from Michigan. So I don't acknowledge his life before he came to Harvard. So for those who don't understand the rivalry, better not understand. So he's an author of over 500 papers his research has addressed the complex ways in which socioeconomic status, race, stress, racism, health behaviors, and religious involvement can affect physical and mental health. He's one of the most cited scholars in the field. He's a kindred spirit because we share the focus on structural issues and sociological issues. He's a good friend, great supporter, and he was a former chair of our department, did an amazing job under difficult circumstances during COVID. More than anything else, David is a moral leader. If you hear David speak, and you will shortly, and hear him operate, the way he ran the department, the issues he brought to the fore, you understand the great sense of morality, commitment, passion he brings to his work and his research. So David, I couldn't be more grateful. Thank you so much for agreeing to do.
So good morning, everyone. It's good to be here. I thank Vish for his kind words of introduction. I'm not gonna continue this, but he's a great colleague and it's a thrill to work with Vish. Okay. All right, so I'm gonna jump right into my talk since I'm time constrained. I teach an undergraduate class in Cambridge later today. So I'm going to talk about racism and its challenges, and I'll certainly want to focus on mobilizing defenses, what we can do about it. So it fits the theme of this seminar today. I want to begin by acknowledging Chester Pierce and the big impact he had on my life and thinking very early in my career. I started my career at Yale University, never met Chester Pierce, didn't read much of his work at that point in time, but one of my primary mentors was a Black psychiatrist by the name of Ezra Griffith. And we collaborated together and we worked on projects and wrote papers together. And I didn't know at that time that Ezra Griffith was regularly driving from New Haven to Boston to interview Chester Pierce. And he wrote the book about Chester Pierce, Grace and Excellence. And these quotes are from the obituary he wrote in a psychiatric journal when Chester Pierce passed away. But every single time I met with Ezra, he talked about Chet. Chet said this, Chet said that, Chet said the other. So I just became an expert on all the things that Chet had said as I listened to Ezra on a regular basis. And his work on inequities certainly is very important. I want to place racial inequities into a context. This is a journal, an article from the JAMA that shows racial inequities in health in the United States means that 203 Black people die prematurely every single day. Imagine a fully loaded jumbo jet with 203 passengers and crew on board, and it crashed today and crashed tomorrow and crashed every day next week and every day next month. That's what we are saying when we are saying that there are racial inequities in health. And these inequities have massive economic costs that have been calculated in the United States. They also have massive social costs. I'm drawing on the work of Deborah Umberson here. Racial differences in health means that Black people have more deaths of friends and relatives earlier in childhood and throughout the life course. Compared to whites, Black children are 3 times as likely to lose a mother by age 10, Black adults twice as likely to lose a child by age 30, and a spouse by age 60. Those are some of the costs of these inequities. And these inequities are not new. They have, in fact, existed for a long time. If we use life expectancy at birth as a marker of overall health, you could see there was an 8-year gap in life expectancy in 1950 between Blacks and whites, and there's a 6-year gap in 2020. If you look at the life expectancy of whites in 1950, 69.1 years, and said, how long did it take for African Americans to have the life expectancy that whites had in 1950? It was 40 years later, 1990, that Blacks achieved the health that whites had in 1950. And what are the contributors to these differences? What drives these inequities? I was trained as a sociologist, and I know that socioeconomic status, whether measured by income, education, occupational status, wealth, is a central determinant of virtually the distribution of every desirable resource in society. This is a study I did with colleagues many years ago using the panel study of income dynamics, where economic status is measured very well. And we looked at the relationship between economic status, national data for the United States, and overall mortality. And you could see that low income, the lowest income category of Americans, have an overall death rate 3 times that of the highest income category, but it's a graded relationship. Every higher level income was associated with, in fact, better health. And race ethnicity is strongly related to socioeconomic status. This is median household income in the United States for 2018. I'm going to put it in a way you can't miss the point. Standardizing on the household income of whites is $1. For every dollar of household income whites households receive, Asian households receive $1.23. Asian households are more likely to be multi-generational than any other group, have more persons contributing to household income. Asian household of the categories there have the highest level of immigrants, have come to the US with high levels of education or have come in pursuit of high levels of education. So they have almost twice the level of college completion as the white population. But if you look at the historically disadvantaged groups, for every dollar of household income white households receive, Latino households receive 73 cents, and Black and Native American households receive 59 cents. That's 2018. You know what is stunning about that 59 cents figure in 2018? That's identical to the Black-white gap in income in 1978, 40 years early. We have made much less progress in the United States than most Americans think. And the large racial gaps in income markedly understate the racial gap in economic status, because income captures the flow of resources into the household, but it doesn't tell us anything about the economic reserves that households have to cushion shortfalls of income. Something happened to my slide. But anyway, for every dollar of wealth that white households have, Black households have 16 cents, and Latino households have 22 cents. That's data from 2023 from the Federal Reserve Board. And when you are low in income and low in wealth, we may all be in the same storm of the pandemic, but we are in fact in different boats. The images didn't come out when I uploaded the slides, it seemed. Anyway, when my career started, most researchers thought that racial ethnic differences in health were simply a function of racial differences in income and education, for example. And if you compared Blacks and whites at the same level of income and education, race would no longer matter. We now know that life is more complicated than that. And I'm going to illustrate that with national data for the United States, a study we did many years ago, looking at life expectancy at age 25 for Blacks and whites. We did the data for income and education. In the interest of time, I'll only show you the data for education. So at age 25, the average white person lives 5 years longer than the average Black person. And if we look within whites with a college degree or more education live 6.4 years longer than whites who have not completed high school. That's bigger than the Black-white gap. And the gap within Blacks is bigger, again, than the Black-white gap. And that's true for income as well. So someone could say, why should we bother to collect data on race, since the income and education gaps are larger than the racial gaps? And I would say race continues to matter at every level of income and education. So white high school dropouts live 3.1 years longer than Black high school dropouts, and the gap widens as education increases. And this is national data for the United States. The best off African Americans, those with a college degree or more education, have lower life expectancy than whites with a college degree, lower life expectancy than whites with some college education, lower life expectancy than whites who've graduated from high school. So what do these data tell us? There's something about income and education that matters for your health, regardless of your race. But there's something else about race that matters, even after we've taken income into account. And what does the scientific research clearly tell us? That racism and racial discrimination are alive and well, and that racism is a critical missing piece of the puzzle to understand the patterning of racial disparities in health. When I use the term racism, what am I talking about? I'm talking primarily about an organized societal system. It's premised on an ideology of inferiority, but it categorizes and ranks groups as some superior, some inferior. It differentially allocates opportunities and resources to groups. Yes, there are negative attitudes and beliefs that lead to prejudice and stereotypes. And yes, there's differential treatment by individuals and by social institutions. But fundamentally, we are talking about a societal system that has pervasive negative effects. And it has upstream structural or institutional effects. Here's a paper I wrote back in 2001 with one of my students, where we argued that residential segregation was a fundamental cause, a driver of racial inequities in health. And we were not the first to make that point. John Sell was a historian at Duke University. He wrote a book about the origins of segregation in the US South and South Africa. He actually showed that the framers of apartheid in the late 19th, early 20th century got the idea of apartheid by looking at how well residential segregation was working in the United States. And he argued that segregation was one of the single most successful domestic policies of the 20th century in the United States. And someone says, but David, what does segregation have to do with anything? Well, think of segregation as a burglar at midnight. It slips into the community, and once it shows up, valuables disappear, like quality schools and safe playgrounds, and access to good employment opportunities, and access to a healthy environment, and safe housing, and high quality transportation, and high quality medical care. Research in the United States reveals all these desirable resources vary by zip code, vary by your neighborhood, vary by where, in fact, you live. Let's look at empirical evidence. Two of America's most eminent sociologists, William Julius Wilson and Robert Sampson, studied 171 largest cities in the United States and said there's not even one city where whites live under equal conditions to those of blacks, and that the worst urban context in which whites reside is considerably better than the average context of black communities. That's what segregation has in fact produced in the United States. And that's a 1995 study, so someone says, have things gotten better? So I'm going to draw now on the work of Dolores Acevedo Garcia, was a faculty here at the Chan School, now with Brandeis. She's created an amazing neighborhood opportunity index, ranking every county and most census tracts in the United States on almost 30 indicators of access to opportunity. And what she finds, as she asks the question, looking at the 100 largest metropolitan areas in the United States, and she asks, which children live in low and very low opportunity neighborhoods? 2/3 of all black children, 58% of all Latino kids, 53% of Native American kids, compared to 1 in 5 white and Asian kids, live in very low and low opportunity neighborhoods. Who lives in high and very high opportunity neighborhoods? Almost 2/3 of white and Asian kids, and only about 1 in 5 black and Latino kids. So research also indicates that segregation is a central driver of racial ethnic differences in socioeconomic status in the first place. I'm going to draw on the work of two Harvard economists. First, we're looking at David Cutler, using national data for the United States, looking at blacks and whites, making it in the labor force. He shows statistically, if you can eliminate segregation, you would erase black-white differences in income, in education, and in unemployment, and reduce racial differences in single motherhoods by 2/3. All of those striking differences linked to opportunity at the neighborhood level. One more study, one more Harvard economist, Rash Shetty, did an amazing intergenerational analysis, got access to census data from 1989 to 2015, and he said, let's look at black and white children who begin life in homes where the family have the same level of income. So he's controlling for parental income. How are the children doing in the next generation? And what he found was that in 99% of census tracts in America, black boys have lower earnings than white boys because they're lazy? No. They're not working hard enough? No. They live in neighborhoods that differ in access to opportunity. Black boys do as well as white boys if they're in neighborhoods with good resources, but few black boys live in those neighborhoods in the United States. What do these data tell us? They tell us that racial inequities in socioeconomic status that matter for life and health do not reflect a broken system. No, they reflect a carefully crafted system, functioning as planned, successfully implementing social policies, many of which are rooted in racism. They're not accidents, they're not random events, they're not acts of God. Racism, through its upstream mechanisms, have produced a truly rigged system in the United States. So I've talked about upstream structural racism. There's also individual level discrimination, and that is a stressful experience. Martin Luther King suggested that this was an important factor. He said that discrimination is a hellhound that gnaws at Negroes in every waking moment of their lives, declaring that the lie of their inferiority is accepted as a truth in the society dominated them. I and others have developed measures to capture the stress of discrimination, and one of the scales I've developed is called the Everyday Discrimination Scale. Does not capture all aspects of racism, just the little day-to-day indignities, being treated with less courtesy and less respect, receiving poorer service than others, and people think you are not smart. I have been struck by the findings with the Everyday Discrimination Scale. Here, I'm going to showcase some of the findings for mental health. High levels of everyday discrimination predicts DSM-defined mental disorders, predicts increased emotional distress, poorer psychological well-being, and also predicts lower adherence to treatment recommendations from providers. And to talk about its physical health impacts, I'm showcasing the work of Tenny Lewis, was at Yale when she did this, currently at Emory University. Each line on this slide reflects a different published peer-reviewed study linking the Everyday Discrimination Scale to elevated coronary artery calcification, to higher inflammation, to blood pressure, to poorer sleep, to more rapid declines in cognitive functioning, dose-response relationship between everyday discrimination and visceral fat, shorter telomere length, a broad range of outcomes. There are today more than 500 published peer-reviewed studies from around the world using the everyday discrimination scale in multiple countries, finding it predicts poorer health. And that's what Chester Pierce said. He said, what the reader must bear in mind is that these assaults to Black dignity and Black hope are incessant and cumulative. Any single one may not be gross. In fact, the major vehicle for racism in this country is offenses done to Blacks by whites in this sort of gratuitous, never-ending way. These offenses are microaggression. And everyday discrimination scale, one of the things that disturbs me is people tell me, oh, they found everyday discrimination scale, they've now captured racism. It only captures one small piece of racism. First of all, in just looking at self-reported discrimination, there are many other dimensions, like the work discrimination measures, like major experiences of discrimination, like unfairly fired, unfairly stopped, physically threatened, or abused by the police. So everyday discrimination scale is useful, but it doesn't capture everything about discrimination. And in fact, when I was developing these measures, I read qualitative research about experiences of discrimination, both by African Americans in the United States and Black immigrants in the Netherlands. And what the research indicated is that people were stressed not only by actual exposure, but by the threat of exposure. And so one of the scales I developed is called the heightened vigilance scale because of the threat of discrimination. How often you think in advance about the kinds of problems you're likely to experience and try to prepare for possible insults before you leave home. Just again, this elevated level of physiological arousal. And by the way, research has found that African Americans maintain higher levels of blood pressure even while they're sleeping than whites. It's like you can never physiologically completely relax. You need to sleep with one eye open, and experiences of discrimination during the day predicts this lack of full nocturnal decline in blood pressure at night. And what the research finds is that over and above the stress of actual exposure to discrimination, the threat of discrimination, the highest scores on the vigilance scale predicts elevated risk of depression and more sleep difficulties, and predicts hypertension in African Americans and other populations. But still, measuring discrimination comprehensively does not capture all of the adversity. I'm going to share with you findings from a study I did with other colleagues, probability sample of 3,000 adults in the city of Chicago. And what we found is that African Americans and US-born Latinos compared to whites scored higher on every measure of stress we assessed. Major life events, of financial stress, of work stress, of relationship stress, of neighborhood stress, plus each of those stresses of discrimination that I talked about. And what we found was a dose-response relationship. Each additional stressor that individuals were high on predicted poorer physical health and poorer mental health. And even these do not capture all the stress of adversity produced by segregation. Segregation leads to high levels of exposure to physical and chemical stressors. This is a paper by Robert Buller, don't have time to go through it in detail, shows in segregated areas all the higher levels of exposure to toxic substances that individuals, in fact, experience. And a priority for research is to document the adverse physical and chemical environment, these adverse physical and chemical exposures, and identify what we can do to reduce them, because they have disadvantaged populations have high levels of exposure and fewer resources like access to green space, for example, to cope with these exposures that they have at such a higher level. The data also indicates that there are hidden ways in which stressors linked to race and racism adversely affect health. One study found that over 70% of Black mothers in this country were very concerned that their children might be harmed by the police. what does that do to their anxiety levels? And here is a study by Brandisha Tynes, was a former postdoctoral fellow with me, where she shows what's happening in the online context. For Black and Latinx adolescents, exposure to seeing someone of your racial group beaten, arrested, detained, or being shot by the police leads to increases in PTSD symptoms and depressive symptoms in the next year. Another study I did with one of my former students, Jacob Bohr, who's a faculty at Boston University. We got a database from the CDC of the mental health of the population in every state. We linked it to a database of every police shooting in the United States. And we found that every police shooting of an unarmed Black person in the United States led to worse mental health, not just for the family and friends, but for the entire Black population in the state in which it occurred, with mental health symptoms elevated for the next 3 months. No, it wasn't every police shooting that did this. It was only police shooting of an unarmed Black person. If a Black person was armed and shot by the police, no negative effect. Suggesting that it's the perception that it was an unarmed person, you didn't have to be doing anything wrong, could happen to you, could happen to anybody in your network. So we're talking about spillover effects of discrimination. And effects of discrimination begin very early in life. One of the most disturbing studies I have read in recent times is a study that looked at suicide in elementary school children in the United States from 1993 to 2012. The rates of suicide were stable overall for the US, but it was stable only for Asian and Latino children. There had been a marked decline in suicide for white children, and suicide rates had doubled for Black children. For me, I try to think back. When I was in elementary school, did I even know what suicide was? So to think of suicide, these researchers have documented, Black children aged 5 to 11 are committing suicide, Black boys and girls, at twice the rate of white boys. What does it feel like to be a Black child growing up in America today? That the environment that Chester Pierce talks about is leading these kids to commit suicide. There's a large national study of 11,000 children, average age 11, that found the Black children have the highest rates of suicidality, thinking about suicide, suicidal ideation, and the highest rates of discrimination. And when they add the discrimination to the model predicting race and mental health, they found that the effect of race went completely away once discrimination was considered. In other words, discrimination completely accounts for the elevated risk of suicidal ideation among 11-year-old Black children. And then, moving along here quickly, another mechanism of racism is the negative stereotypes that exist that trigger reduced access to societal resources. I'll just touch on one of them. Is medical care. The unequal treatment report from the National Academy of Medicine documented across virtually every therapeutic intervention, Black and other minorities receive fewer procedures and poorer medical care than whites. That's from the Washington Post. That's a press conference. I served in the committee back in 2003. I want to share with you, last year was 2023, 20 years since the release of the unequal treatment report. I spoke at 2 or 3 conferences saying, what have we learned in 20 years? You know what we've learned in 20 years? More evidence that the problem persists. That's all that has happened in the last 20 years. I'll give you one study to illustrate it. Study of 318,000 elderly patients, all with Medicare, all with terminal cancer in their last weeks of life. And the question is, do they get opioid medication for their pain? Older Black and Hispanic patients with advanced cancer, less likely to get opioid medication. If they get medication, they get a lower dose. And Black patients are more likely to undergo urine drug screening to see if they're abusing opioids. And Black men experience the greatest inequality in not getting the medication for the pain and having to do urine drug screening. So what can we do about these? Strategy number 1, we need to build more health into delivery of health care. We need to improve the quality of care. We need to reduce implicit bias. We need to diversify the workforce to meet the needs of all patients. We need to provide care that addresses the social context. I don't have time to elaborate on all of these. So I just want to talk about 2 things. Implicit bias. Most healthcare systems in the United States do something about implicit bias, have their employees take a workshop, a short videotape, online program. These do not work. They raise awareness levels. They don't change implicit bias. I'd like to talk about the Divine solution. Professor Patricia Devine at University of Wisconsin has developed a program that is effective in reducing implicit bias, and it is the most effective program been documented. What's different about it? It's a 12-week program with homework exercises to complete. What else do we need to do? Diversify the workforce to meet the needs of all patients. A randomized control trial took Black men, sent them to a Saturday morning clinic. Once they got to the clinic, they were randomized to see a Black doctor, a doctor of another race, and there was greater engagement with the healthcare system for those who saw a doctor of their own race. A recently published study, national data for the United States, all counties found that in counties where there are more Black primary care physicians, the health of the entire Black population is better. We have a huge shortage of underrepresented minorities. Strategy number 2, we need to identify supportive and protective resources. Here is a study done that found Black teens who experience discrimination as a teenager, 16, 17, 18, biological dysregulation by age 20, those who are high on social support, no negative effect. Another study, teaching parents effective parenting, teaching Black adolescents self-regulation and Black pride, reduces the exposure to discrimination, does not have any negative effect on their health. A national study of African Americans, 3 aspects of religious engagement, frequency of church attendance, church-based social support, and seeking religious guidance in their everyday life, reduce the negative effects of the stress of racial discrimination on their mental health. We need to comprehensively identify all the resilience factors and resources. What else do we need to do? We need to reduce inequities. I call it creating communities of opportunities, invest in early childhood, reducing childhood poverty, enhancing income and employment opportunities, improving neighborhood and housing conditions. All of these, this is a review paper with Lisa Cooper. We showed the evidence that these things work. So we just need to move forward. What is holding us back? What are the barriers we need to address? There are 3 of them. Most Americans, national data reveals, do not know that racial inequities in health exist. So we need to raise awareness levels. We need to develop political will. We need to build empathy. I leave you with 2 quotations. Martin Luther King said, "It may well be we will have to repent in this generation, not merely for the vitriolic words and the violent actions of the bad people, but for the appalling indifference of the good people." We cannot be indifferent, and we need to be engaged in addressing inequity. And finally, the words of Robert Kennedy speaking in South Africa. He said, "Each time a man or woman stands up for an ideal or acts to improve the lot of others or strikes out against injustice, he or she sends forth a tiny ripple of hope. And those ripples can build a current which can sweep down the mightiest walls of oppression and resistance." It's my hope that each one of us today would resolve that going forward, we will be a tiny ripple of hope. And together, we can sweep down the mighty walls of oppression and resistance. Thank you.
Hello, everyone. My name is Emry Breedlove. I was priorly a master's student here at the Harvard T.H. Chan School of Public Health, and I will be one of the hosts today. So first, I want to thank Dr. Williams for his wonderfully insightful presentation. I couldn't help but take notes like I was being a student again. So now we will begin with our panels. Our first panel is tapping into what many of us are working on in this moment. The panel is entitled Resilience in Times of Adversity, Institutions, Individuals, and Community Strength. Our panelist and moderator will discuss methods of maintaining positivity and a sense of purpose within a world fraught with what feels to be unending social tension, political unrest, and systemic discrimination. Additionally, we will discuss what kinds of interventions institutions can take to mitigate these obstacles and promote resilience, belonging, and positivity in our community. Our panelists will each share their insights. After this, our moderator will lead a discussion, and afterwards we will have a Q&A. So be sure to take some notes, just like I was. May I have our moderator and panelists for panel 1 take a seat at the front. And as they're making their way, let's give them a round of applause. And so I shall do introductions for our panelists and moderator. Our first panelist is Dr. Nancy Michael, co-director of undergraduate studies for the Neuroscience and Behavior major at the University of Notre Dame, a recipient of multiple awards such as the Society for Neuroscience Next Generation Award, the Frank O'Malley Undergraduate Teaching Award, and the Doc Weiler Award for Excellence in Undergraduate Advising. Dr. Michael professes not only an exceptional knowledge of neuroscience, but is also dedicated to excellence, innovation, and in education and promoting community well-being. Dr. Michael's work uses a near science approach, standing for the fields of neuroscience, epigenetics, adverse childhood experiences, and resilience, to develop population-specific strategies to support organizational and community efforts in becoming trauma-informed. Our second panelist is Ms. Julia Hotz. She is a solutions-focused journalist and author of the book, The Connection Cure, The Prescriptive Power of Movement, Nature, Art, Service, and Belonging, published just this past June. In her book and in her journalism, Ms. Hotz explores the treatment called social prescription, a social determinants of health approach that utilizes referrals from healthcare professionals to social, communal, and recreational resources that promote social connection, promote health, and help heal from physical and mental illness or disease. Throughout her work, Ms. Hotz highlights success stories of innovative patient care by interrogating what it takes to promote positive health outcomes structurally, communally, and individually. And our moderator for this panel is Dr. Brittney Francis. Dr. Brittney Francis is a research scientist from the FXB Center for Health and Human Rights. Her research centers the equitable prevention, diagnosis, and treatment of maternal hypertension for Black women around the world, aiming to minimize the inequitable rates of maternal morbidity and mortality that Black women experience. As a public health researcher dedicated to effecting positive change in the world, Dr. Francis advocates for empirically informed public health policy and practice. Highlights of her work includes providing testimony to state and federal legislature, publication within the American Journal of Epidemiology, features within the Boston Globe and the Miami Herald, and creation of educational content on TikTok. Dr. Francis demonstrates great efforts towards disseminating resources that promote resilience across many realms of public health. Please join us in a warm welcome to our moderator and panelists.
Thank you so much, Emry. So I think to catch up on time, we'll just go ahead and get started. So Dr. Michael, if you can go ahead and give us your remarks, and then we'll transition over to Julia, and then we'll go ahead and get a conversation going.
Oh, cold start. Hi, I'm Nancy. Thank you so much for the opportunity to be here today. So in the context of institutions, individuals, and community strengths, we'll take it in a little bit of a different order. Maybe it might feel a little circuitous, but I promise I will get to the point. All right. So from an individual perspective, I had a very meandering path to what I do now. The kinds of questions that brought me back to graduate school, I worked for almost a decade after undergraduate. And I was really wondering, like, I'm in the middle of 3, and I was like, wait a second, same biological parents. But by the time we were in our mid-20s, I was the only one that had completed school, that had not experienced some significant mental health issues, or was not addicted to one or multiple substances. And so the kinds of questions that brought me back to graduate school were like, okay, genetics doesn't explain everything. I grew up in the 80s where it was like this raging nature versus nurture debate. And so I was really curious about the differences between kind of what people would say and then how their behaviors would show up in the world. Specifically, my brother, who has given me permission to talk about these things in public forum, developed quite a significant heroin addiction. And there was a time we lost a dear friend, and he was like, Nance, I don't want to end up like Steve. And he was very sincere in that, but like couldn't figure out how to not do that, not to continue to use. So over time, I'm happy to say he's alive. He's been sober for a very, very long time. He's the strongest person I know. But what brought me back to graduate school were these kinds of questions, because I looked at him and I was like, man, I know you're not lying to me. But that was kind of still continues to be some of the major kind of cultural narratives of like liar, cheats, thieves, manipulators. And so throughout my graduate career, I learned a tremendous amount about this thing called experience-dependent plasticity, which is basically like if you assume a full-term kind of normative, healthy birth, like every baby is going to be born with a brain that looks like a human brain, kind of reproducible. But then there's all this stuff that happens that helps form the very specific connectivity, and then ultimately becomes kind of the functional weighting and all of these things of the central nervous system. And so when I was in graduate school, I was learning all this stuff, and I was like, man, that would have been so helpful for me to know as a teenager, for my family to understand, for like any caregiver ever, maybe any educator ever, maybe any person ever. So as I made my way through graduate school, I had these opportunities to work directly with community in educational settings. I was like, yeah, that's my jam. I'm going to do that, right? So when I got the opportunity to come to the University of Notre Dame to help start their neuroscience and behavior major in 2015, it was a very easy yes for me to be able to focus on kind of educational and curricular developments with ideas about, right, I had been formed in my academic course, the ways in which neuroscience doesn't solve problems, but it surely seems to help people like, oh, I'm not crazy. Oh, it was okay for me to be a sad kid. Oh, and like all of these moments of like, not only like realization, but like grace and forgiveness and hope. So over time, I've been there for about 10 years now. I had no idea what I am doing now was possible, even at the time that I started. So community engaged learning was not really a thing in most of the academic settings that I had been in previously. It was like extracurricular or something like that. But at the University of Notre Dame, it's a Catholic institution, and there's this really beautiful phrase in their mission that education should be in service to justice, right? That our goal as educators is to develop a disciplined sensibility of the poverty and justice that burdens the lives of so many, so that education can be used in service to justice. So there's like this beautiful kind of like call to action and requirement of action that I would offer is actually present in most institutions of higher education in some type of leadership development or civic responsibility, right? That knowing stuff doesn't necessarily translate into doing things, or like actually taking your education in ways that it can inform relationship, people, practice, community. And so over the 10 years that I've been there, when I arrived, from a community perspective, I work very closely at this point with one of our health systems. And every 3 years, they do a community health needs assessment, which looks at kind of many of the factors that Dr. Williams was discussing. And childhood abuse and trauma was identified as the number 2 health concern, second only to obesity. And so the health system was like, gosh, that's bad. Well, what do we know about that? And so they did a lot of research, and they were curious about, so what, yes, that's an environmental pressure from an experience-dependent plasticity perspective. And that type of environmental pressure really is at a distance from what a nervous system expects, right? Like if you think about what a baby can do. Okay, this is my baby. Right? Like babies are obligated to be dependent upon the world around them. And through this principle of experience-dependent plasticity, are shaped and formed by these pre-existing nervous systems that set the map of this kind of bottom-up development. So a question that Beacon had in this context, okay, so that's bad, childhood abuse and trauma. Number 2, health concerns. Second, obesity. What do we do? Right. And so again, some of the kind of the solutions focused awareness raising is the first part. The vast majority of people, like the academy, might have access to this tremendous evidence base, but the vast majority of people don't have any idea, right? Because there's a lot of access issues there, not only in terms of like paywalls, but also like language. Like in the academy, we tend to have a very precise dialogue within our fields that like my friends are like, Nancy, stop talking like I don't know why you talk like that. So in this context of community engaged learning, it happened to be coincident to this community conversation around adversity. What do we do? So the health system brought the ACE interface, which is the Adverse Childhood Experiences Interface, which is an awareness raising platform. And it was coincident to my arrival and curiosity about how you engage in community engaged learning. Like, how do I make what my students are learning in the classroom kind of practically relevant in the context of community? And so it's been over time, then over those last 10 years, that those relationships have grown. We have a number of different curricular offerings. Another barrier that I learned about through these conversations was, again, from an academic perspective, a lot of our timelines, our priorities often become like trust breakers and relationship breakers with community, because we work on grant deadlines. We have this amount of time. We have an a priori hypothesis, and we go in and we collect information and we get our data, and then that's usually where we drop it. Because anyway, so one of the strategies is also thinking about sustainable engagement, right? How do we thoughtfully listen to community needs and respond so that we can have students and faculty and staff kind of engaged over the long term for continual support. And so all of these now kind of, I co-founded a nonprofit called Self-Healing Communities. And that works to mobilize kind of the evidence base of what the undergraduates have access to. So they're like our volunteer army in many ways, in terms of the production. But students are paired with community organizations. We work in organizational capacity building, but it really is very much just about like the academy. I'm pointing up here to reference the slides that were presented in the last session. But right, that like neuroscience doesn't solve problems, but if we can translate what we do understand about these obligations of nervous system and physiological development, that we are indeed built from the bottom up, and we are subject to forces that have been around for generations that are like tacit and invisible if we have no experience with them. And even if we do sometimes have experience, right, that like most of experience does not live in this declarative narrative space of cognition, right? It's this sense, it's this feeling, it's the change of body state when we walk into a room. Well, again, neuroscience doesn't solve all of that, but to be able to explain it and map out a circuit and be like, no, that's a real thing, right? We do this like instantaneous neuroceptive bam, 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 bam of safety or not. And all of those impressions cumulatively over a life course put pressure on moderating expressions of health and well-being on a system. And so we work our community partners let us know what their questions are, what they need, and we work I do the research, identify the evidence base to translate to whatever those community needs are. Thank you.
As a STEM nerd, I have a lot of questions. I'm very excited for that part. Julia, would you like to share your remarks?
Yeah, absolutely. Thank you so much. Thanks, Dr. Michael. Thank you, Dr. Francis. I'm not going to lie. I completely scrapped and redid my remarks after hearing Dr. Williams speak, because to me, that was a before and after. I mean, you cannot unhear those statistics. And when I'm looking around at the faces of people in the room, I was talking to Emry earlier about some of their research, Dr. Bassett, Dr. Vish, all of you understand in your work that this is not an optional thing. The communities, the presence of social support, opportunities for belonging, opportunities to have your basic needs met determines our health. It drives our health. And I want to talk about two people who, to me, personify what it could look like if our healthcare systems took this more seriously. And it's through this practice called social prescribing. Now, if I had time, I'd go up to each of you and we'd sort of crowdsource our social prescriptions together. But the basic idea behind this is a social prescription is a non-medical, community-based activity or resource designed to improve our health and strengthen our connections. So that could be everything from an art class to a nature walk, but it can also include support with finding a job, money off your monthly rent check. It could include cash for groceries. All of these are social prescriptions, right? And I want to talk about two people who, by the way, I'm not a researcher. I just get to listen to all of you and understand, how this research is being applied in the world. I'm a journalist, and I met two people to me who personify what social prescriptions can do for our sort of crisis of unmet needs, of racism, of lack of spaces for belonging. So one of them was in Australia, and I meet this woman named Kuhn. And Kuhn, she's got a Psyduck tattoo. Psyduck's a Pokemon. And I could just tell she has this creative spirit about her. But when she starts to tell me about her life, she starts to tell me that Kuhn actually never had a chance as a child to develop that creative spirit because she was the daughter of of refugees from Vietnam, whose sort of call to her was to survive and help the family do the same. So there was no time for fun in Kuhn's childhood. It was helping, translate her parents' doctor's appointments. It was working jobs when she was a kid. It was saying no to play dates, saying no to sports, and also enduring the abuse that came from her parents, who they themselves were the recipients of abuse. So Kuhn grows up and she deals with some symptoms of post-traumatic stress disorder. She deals with some symptoms of depression and suicidal ideation. But then Kuhn gets what's called a social prescription. And I should say that the tagline of social prescribing is about shifting from what's the matter with you to what matters to you. For all of Kuhn's life, she says, I was a trauma story. All of my symptoms could be explained by this generational trauma and adverse child experiences, everything the literature tells us. But through this social prescription for what's called a creativity workshop in her community, put on by local artists, libraries, community gardens, Kuhn gets a chance to experience some joy and belonging again. And she was scared at first. She tells me that as a child, whenever she tried to sort of become herself, she was reprimanded. So this was Kuhn's first chance to really have a chance at being a kid again. And when I'm describing this story in this, tight time setting, it's going to sound like a miracle cure before and after. But truly what Kuhn said to me after that 10-week course is that the whole course of her PTSD and depression and outlook on her life changed. She said that before this, her life was about surviving, but now she sees a life beyond just making out the day. She sees that actually she loves to create art. She takes me to her apartment and she's got art all over the wall. She's got plants all around her. And it was a chance for her to go from surviving to thriving, and all through this social prescription, right? So imagine if our doctors here could prescribe us community activities and resources just like they did for Kuhn in Australia. I'll tell you about one more example that was particularly inspired by Dr. Williams, and this takes us to Canada, where we meet Victoria. Victoria is a Gen Z. She's super cool. She's really funny, and she's got these ripped jeans, and she seems like the kind of person I would want to be friends with, honestly. But she tells me about her life, and she says she has no friends. And she tells me this is a common experience, I think, for people her age, that she had sort of outgrown her friends, and they wanted to party and drink, and Victoria had to worry about paying the bills and wanting to prioritize sleep at night. And she started to feel like these people who she grew up with, no longer made her feel a sense of belonging. So eventually she has sort of a friend breakup with these people. And this was so stressful for her. I mean, she starts getting these panic attacks. She can't sleep at night. Finally, she goes to see a social worker, and the social worker says, Victoria, you never really got a chance to get to know yourself. And Victoria, by the way, I should mention now, is Black and lives in Toronto and had experienced some racism in her life. And lo and behold, Toronto is sponsoring what's called the Black Focused Social Prescribing Project, where people like Victoria, who are experiencing some mental health adverse effects of racism, actually get prescribed in a cohort of other Black people in the community who get to go to the community play together. They take dance classes, they take cooking classes, all run by this community health center, all documenting the before and after effects. So Victoria gets this social prescription, and she says to me in very real Gen Z terms, like, I'm not going to lie. It's not like I go to this social prescription and I feel like I have 10 best friends, but I feel like I'm getting to know myself better. And that's a start. And there are some people I can laugh with and have joy with. And so Victoria and Kuhn, I think, personify what happens when we treat our community resources, our art workshops, our plays, our dance classes, our cooking classes as medicine. We think about all the research and development that goes into developing treatments for depression and anxiety afflictions that Victoria and Kuhn experienced. What if that money could go into our community and addressing some of these inequities that Dr. Williams talked about? This is what social prescribing is all about. And I have good news. This is coming to the United States. In fact, it's already here. At Harvard Medical School, you have students who are advocating for social prescribing that is addressing the social determinants of health with non-medical community resources. They are advocating for this to be taught in their curriculum. You go further up the street to Boston Medical Center, there are doctors who can now prescribe books. They can prescribe legal support. They can prescribe housing assistance. They can prescribe food. And when you look at the long-term effects of these programs, you find that people's health does improve. So I feel like I've perhaps erring towards the time limit. And I'm sure you have a lot of great questions about this, because one thing I will say is when I first learned about this as sort of a skeptical journalist, I said, this all sounds well and good, but we can't just rely on medicine to fix these structural inequities. We also need support from governments. We also need policies that are anti-racist. But what I think this does, it's kind of like if anyone has kids here, and you sneak like broccoli into their dessert. I think this is a way of getting healthcare to address some of these social determinants from the inside out. Because when you see a patient who's presenting with depression and anxiety or PTSD or panic attacks or chronic pain or type 2 diabetes or dementia, all of which have been related to our social determinants of health, you want to know, what medicine can I prescribe? And I think it starts with understanding that our medicine doesn't just come in pill bottles. It comes in what's around us. So thank you.
Thank you so much. Okay. Both of these were very, very interesting. So as a person who studies structural racism, particularly looking at segregation and what that looks like in terms of inequitable distribution of resources, how that impacts stress, particularly around the placenta, and also thinking about sort of like the endocrine pathways. This has been really, really fascinating. And I think this idea around social prescribing for me is more of a public health model. So I think like a main difference that we often talk about between medicine and sort of public health is this idea of sort of reactive or being able to prescribe medications and think about sort of a solution plan after a diagnosis, versus the idea in public health of thinking about how we can prevent sort of these diseases, right? And in public health, I think we see a large shift back to this idea of social justice and thinking about ways that we can address social inequities as a way to reduce health inequities sort of globally, but also to think about how we can improve health and happiness and well-being sort of outside of this absence of disease. And so I think one thing that we sort of have heard about around this idea of adversity and what that means in terms of social determinants of health is the harm that it causes, and thinking about the ways in which inequitably that harm is distributed based off the idea that we have things like gender-based violence, structural racism, we have capitalism, we have all of these sort of structural forces that create inequities around these stressors. A large topic that comes up, which I will admit I have sort of a problematic relationship with, is this idea of resilience. And so, as sort of was stated in the beginning, is we all sort of, as academics, as journalists, as people that engage in this work, sort of think differently about what that is. And so I was hoping that you could share with folks, both sort of in your work, how you would define resilience and what that looks like, sort of in the context of what you do and how you want people to think about happiness, well-being, and overcoming adversity.
So resilience. Yes. There are lots of like definitions and things, and I'm like, well, okay. So in the community work that I've done, sitting in a number of different settings, and one very, very strong community activist got up in one of these meetings, and he was like, DSM, bouncing back from adversity, and he was like, that's good enough. When do you bounce back? You know what I mean? Like, so it started this conversation. He's like, I bounce forward, right? Like if I go through all that stuff and I'm just the same person that I was before it all, like what? Like he was unsatisfied. And so out of that, our kind of community definition of resilience in these conversations became, it's like bouncing forward, right? That like, that life is necessarily going to offer some friction disproportionately for lots of reasons. But the resilience would be like when that friction occurs, we're like pushing on the system. And the way that social support, the way that resources, the way that access, right? It helps reinstate or tip back the balance. So I think about resilience as yes, absolutely, it's bouncing forward, but from a nervous system perspective, right? The points of communication across the nervous system and in conversation with endocrine systems and physiological systems, our synaptic contacts when we're talking about within nervous system contacts, or the ways in which changes in central nervous system function can shift bodily function. And so the way that I think about resilience kind of from that mechanistic perspective is the body's ability to experience challenge. So to get like pushed out of like homeostasis, right? But like autonomic balance, right? Because the system is designed to be flexible. There's never been a point in human history where like there haven't been stressors. So like we have the ability to get pushed and stressed. But the importance in the context of resilience is the actual like structures that allow for the functions to reinstate autonomic balance after we get shoved out of the way. And depending on the stress dose or the load or that, right? Like some systems develop in such a way that they're adapting, right? This idea of hypervigilance or being alert or like stress dose, right? That like some systems grow up in ways that they're really, really, really good at managing all of this high pressure. But from a health perspective and from a well-being perspective, the system necessarily needs to spend more time in kind of an autonomic balance or a parasympathetic space as opposed to a heightened sympathetic space or an autonomic shutdown space. So long answer, sorry about that. That's how I think about resilience, right? It's the flexibility, it's the diversity of function that allows us to experience challenge and reinstate and recover balance, which is where social networks are so important. Because we're like an obligately social species, like we're obligately interdependent, and we never outgrow that. So,
yeah, I would build on that. I totally agree. I'm with you with the sort of eyebrow raise at resilience because it kicks it back to the individual, right? It treats resilience as this thing, wow, she was so resilient through that adverse experience, and that sort of like normalizes this idea that it's a function of the individual. So I would build on what you're saying and suggest that that word has a function because it's true. Humans are incredibly resilient. But I also think the last part of what you said is really important, that humans are incredibly resilient and we evolved to be with the community. We didn't evolve. We didn't descend, from the sky and get put down onto this earth that sort of segregates us and isolates us and has these power imbalances. we were all at one point kind of trying to figure it out together. And so I'm grateful for social prescribing because I think it sort of shifts this idea from, kicking it back to the individual to heal from social determinants, and suggests that if the stressor is social in nature, the medicine should be too. And so one example I see of this, just real quick, in California, California was one of the first states under Dr. Nadine Burke-Harris, an incredible force in talking about some of the same points Dr. Williams did, toxic stress. Dr. Nadine Burke-Harris passed legislation that would allow for doctors to screen for adverse childhood experiences and prescribe them, help cover the costs of prescribing something to address those adverse childhood experiences. So one example I heard of this was from a doctor I met who told me that she had seen an infant who was severely underweight. She sees the infant and the mother, the infant's severely underweight, and she's asking all these sort of biomedical questions, does he eat, blah, blah, blah. They can't figure out the cause. And then they do this ACEs screener, this adverse childhood experiences screener. And through that screener, it comes out that the woman's husband, the child's father, had been deported. They were now trying to survive on one income instead of two. They couldn't afford formula. So the mother had to water down the formula for this child. And lo and behold, that is why the child is underweight. And so through Dr. Burke-Harris's work and through, the sort of legislation and policies that made it able for that doctor to be able to then prescribe something to address the root cause, she's now prescribing formula to that mother instead of saying, I don't have any answers for you. That was kind of a tangent from resilience, but I think it just shows that we can't just say to that infant, be strong, be resilient. They had an unmet need. And I think, the more we can talk about the way, our community resources and activities can address those needs, the more we sort of move away from that problematic framework of it all comes back to the individual.
Yeah, I agree. So not a tangent, I actually think that's a good example and segue into a question that I have. And sort of like setting up the framing of that question too, right? Like I think going back to the talk earlier and just thinking about the reference of my work and even what you were saying around sort of this co-regulation, right? Like the baby is born in an environment that might already be dysregulated because of these stressors that the mother might be experiencing during pregnancy, right? And that sort of like starts before the baby is even sort of like fully developed and sort of thinking about how that brain, right, is working. And so in your example, when you're talking about this idea of, right, like food insecurity is what I hear, right? Like this idea around food insecurity, but also we're talking about social support. But in this example, we have a parent that's now been separated from the family. And we are not thinking about how to address that, right? Like it's like there are sort of mitigation factors that we can think about, like prescribing the milk, which is like absolutely necessary in terms of the health of the baby. But how do we think about the role, I would say, of like governments or corporate actors or other sort of community organizations in sort of thinking about how to build resilience around some of these larger topics, in addition to, right, because we're talking about sort of upstream and downstream, how do we think about the roles or the collaborations that we could be having where we say, this person came in and we need to prescribe them milk because it's a very immediate need. And we need to have a conversation about the fact that when we filled out the ACEs, these are all the things that came up, right? Because on that ACE screener, we hear things about mass incarceration, which is also around sort of family separation and thinking about sort of like the resilience factor. And more kids that are engaged with these systems, right, are having to experience more of these ACEs, right? And so now we're talking about sort of the system that is built up where more of these kids are having to deal with more of these issues. So I'm curious in your own work, right, and sort of thinking about sort of little p and big P, is sort of like how I think about it, is how do we sort of couple these efforts that we're already doing to be able to think about the role of larger institutions and sort of like shaping structure?
I could go first if you. I love that question, and if I could just share one more story to illustrate that. I love this story. It's such a like badass stick it to the man story, and it happened right around the corner from here. That really gets to that question. So once upon a time in 1993, there was a doctor. His name's Barry Zuckerman, who kept seeing patients who were children rather who were dealing with asthma. And he thought, this is weird. I'm seeing so many asthma patients. And then he did something strange. He looked at all of their medical records and he realized that they all lived in the same apartment block. And we know now, the public health folks in the room probably know that asthma is highly correlated with mold in the home. So Dr. Zuckerman puts 2 and 2 together and says, all these kids I'm seeing in this same apartment block, I'm going to bet that there's mold in the home. Sure enough, he checks it out. There's mold in the home. And what do you do at that point? It's illegal, by the way. If you're a landlord, to permit, your tenant to have a certain level of mold in the home, clearly because it's causing health damages. So Dr. Zuckerman tries to call the landlord and say, hey, there's mold in the home and it's actually making my patient sick. Can you do something about it? The landlord doesn't do anything about it. He tries to get the patients to be resilient. And can you do something about it? No, they can't do something about it. Then Dr. Zuckerman happens to have a friend who's a lawyer. The lawyer tells him, these landlords are violating X, Y, and Z statutes by continuing to allow mold to exist in this home. So then the lawyer calls them. And what do you think happened? Oh, the landlord removed the mold. So I tell that story because actually this program called Medical Legal Partnerships, which began here in 1993, has spread to many different healthcare institutions all around the country because it has been shown that the presence of a medical legal partnership can reduce hospitalizations, can save cities money. And unfortunately, we know the harsh truth that it's not just enough to sort of have a moral conviction to address these basic human needs. The data needs to show it. We need to show that it's proving money. We need to prove that it's saving money, that it's reducing, pressure on healthcare. So I think when we think about that question of how do we get these bigger institutions, we need to show that when we invest in community and resources for people's basic and psychological needs, this is actually good for the system. Another example real quick is in Massachusetts. You're one of the first states to have a statewide arts prescribing program. You have over 300 arts and cultural partners that are now part of this program with hospitals and insurers to actually prescribe spots in art classes. And why would an insurer get behind this? Same reason. If people are connected to sources of social support and well-being, then this is actually shown to reduce pressure on healthcare and save money over time. So I think it starts with that.
I don't know powerful people. So this idea of policy, like big P, little p, I always it's one of those things. One of my favorite quotes is by a woman named Alice Walker. She was a poet, playwright, activist. And it goes something like, the most common way people give up their power is thinking that they don't have any. And so when I think about policy, I easily land in a space of I don't know anybody. I grew up in Livonia, Michigan. I went to Western Michigan University, and within the first week of being at Notre Dame, when people, us academic folks, we do this so where'd you do your training? As this vetting thing, right? And I was like, well, where'd you, and I was like, I went to Western Michigan, and then I did my graduate training at University of Minnesota. Long pause, and this person was like, well, can I touch you? Well, you got here. I was like, all right, sweet. Thanks, man. Okay, so that's all to say, right? So this idea of capital P policy is really, really terrifying for me because I'm like, I don't even know how to engage. But I do believe that the most common way people give up their power is thinking that they don't have any. And I also would offer that I think neuroscience has evidence as to how that happens from a computational perspective with stuff coming at you your whole lifetime, right? We can talk about it as learned helplessness, or you could be like, wow, let's stop beating up on people, right? Okay, so to the point. So a lot of the work that I do is this translational stuff. So from a policy, I would say little p policy through these translational efforts. I'll give one example. We worked with a number of years. There's an organization called the Family Justice Center, which is the local resource center for families who have experienced domestic violence. So it's the grown person protection. They work very closely with an agency called the Casey Center, which is the kiddo protection. And they obviously interface then throughout the justice system because they're dealing with domestic violence issues, right? so over the years of our partnership, right, like Nancy, neuroscience doesn't solve problems. Nancy doesn't do a whole lot, but in supporting the translation of the primary literature to resources for the Family Justice Center, we've helped support the pilot grant for a collaboration between the Family Justice Center and the Sheriff's Department. So this was back in 2020, where this pilot grant, so the students worked with Family Justice Center to say, like, these are the kinds of things that happen in crisis moments, right? The unreliability of the person who experiences the domestic violence, right? Like, they're unreliable and they're emotional, and they're not valid witnesses when it comes to testimony in the eyes of the court. So kind of helping unpacking, like, in a near-death, often suffocation experience, here's the way the brain changes, right? Okay, so the pilot was able to support a trial of getting a social worker, a mental health professional, to go out on calls to domestic violence calls with the sheriffs, the actual police officers. The success of that pilot and de-escalation and getting people kind of the appropriate resources that they needed in that moment reduced arrests and increased, like, safety things, right? Referral to actual support. The success of that pilot resulted in a full-time social worker that we know, and then we started partnering with. So there's an actual crisis unit that lives within the Sheriff's Department now, so that any kind of mental health or domestic call not only gets an officer response, but also a social worker that goes with the call. That, again, kind of their internal tracking over time has demonstrated enough efficacy that they now have 2 full-time social workers. So that's where like I would say, like, think globally, act locally, right? That we all have the ability to do things if we can, like, kind of position our behavior differently because of what we know, right? I would totally agree that like this idea of, like, knowledge does not change anything unless we're enacting it in some way. And so from a little p, and so that I can give a number of examples, but that's just one in which, like, I didn't do anything necessarily, but through kind of changing deliberation and thought processes and being able to help support the evidence collection for our community partners, they've been able to change organizational policy that does have an impact on the community at large.
I would argue that's a big impact, especially to Julia's point around sort of like data, right? Like, all of these things need to be sort of like backed by data, and sort of academic and higher ed institutions are usually the ones that are producing that level of data towards that problem to be able to move that forward. So I guess a question that I have for you, sort of following up on that, is, like, I think we're all here because we want to be able to do that. How are you actually doing it? Like, how do you do that in sort of the capacity of academic and higher ed? And how does that work in terms of, like, building community resilience, centering community, thinking about what that means, right? And the example that you gave earlier, shaping the frameworks of sort of how you're thinking about community resilience. Like, how do you do that?
I'm not tenure stream. That was a good academic joke, wasn't it? Yeah. But seriously, I would say, right, like I through the experiences that I had, so I had this very meandering course back to graduate school. So these questions of, like, who are we and why are we here, and purpose, right? That those are actually, like, fundamentally important for, like, well-being and, like, healthy, balanced nervous system function. While quantitatively, one might look at my life course and be like, oh, she shouldn't be where she's at. I think qualitatively, right, this idea of resilience, right, that when we have friction coupled with support, like, it actually builds capacity. All right, point. So that when I chose to go into education, it was a very intentional choice, despite the fact that a number of people were like, really? But the I am not bound by, right, like my purpose, myself is filled through education and making what we know matter. Right? Matter enough, right? I truly believe that in education, we should be changed by our education. Like, we should be different people because of what we study, because it matters to us deeply, because otherwise we have all of this evidence that we've had literally for decades, and we're just getting worse. Oops. Right. So, okay. Yeah. So that but the confidence to know yourself well enough. There's absolutely give and takes with any position. I'm able to do what I do because my primary responsibilities are to support and build an undergraduate an unsurpassed undergraduate experience. And the extra that I do is all of this community work, because what I understand about an education that can be used in service to justice is that it requires this ability to be forced to integrate what you're learning in the context of people and real life problems. Neuroscience is an easy discipline to position those kinds of questions from, but I don't have to do any of the community work. I choose to do it because that's to me like the how and why it matters. Did that answer your question?
I have one more question for Julia, and then we're going to open it up to the audience. So if you have questions, you can start thinking about them now. I think like sort of in that last vein of what you were talking about is like, you don't have to do it, right? Like you choose to do it. You choose to make it sort of a central part of your work. And as a person who also does that intentionally, it takes considerable amount of time and effort and intentionality above and beyond like what you're already doing. I think even in the example that you gave of Dr. Zuckerman, okay, is right. Like he had to like call his friend. Like it's like I'm not even at work, and now I have to like call my friend to ask how to do that, right? Like it takes a considerable amount of intention. And so my last question to you is sort of thinking through that idea of like the time, the intentionality that it takes on both sides, right? Like for a person that is facing adversity and you tell me to go to an art class, when am I going to do that?
Right.
Because I'm already stressed out, girl. Like I don't have time to do that. And so how do you think about like addressing sort of the skepticism, both on the social prescription of engaging, right, in a capitalistic, individualistic already society, and then sort of on the flip end of thinking about folks who are trying to do that intentional work? How do you address sort of like the skepticism around having the time to be able to engage in that level of social prescription?
Exactly. We're like telepathically connected. I was hoping you would ask that because that's one of the biggest things I get. Yeah, social prescription's nice to have, but if my problem is that I don't feel like I have enough time to engage with my community, how am I going to make time for it? So I address this exactly in the book with somebody who says pretty much exactly that. This comes from a woman in Vermont who was dealing with stress and panic attacks and insomnia. She goes to the doctor and the doctor says, I think you're stressed. And she says, yeah, that's really helpful because she's also working 3 jobs and has to take care of her grandmother and so on and so forth. So what the research tells us about, we could say art, but also nature, access to nature especially, is that it does something really interesting for us. And I think it's because of the way that the 5 sort of types of social prescriptions, my book focuses on movement, nature, art, service, and belonging, because we evolved to sort of spend our time in these ways, to pay attention to nature, to share stories with one another. There's something deeply physiological about this that resonates with us. And so where am I going with all this? When Heather, the one who's stressed about stress, who doesn't have time, gets a nature prescription, because nature, spending time outside was something she loved to do as a kid, but hasn't had time to do so since, something amazing happens. First of all, it's a prescription coming from a doctor. So there's a sort of like authority to it. There's also an accountability to it, that she is now prescribed a spot in this, nature excursion group that meets once a week on Saturdays at 10 a.m. They're expecting her to be here. There's that. And then there's the promise of healing. There's the promise of medicine, right? No one would say, I don't have time to take my blood pressure medication. I don't have time to take my antidepressant. In the same way, for social prescriptions, what they can give us is the perception that we have more time. What they can give us is sources of well-being that actually help us ruminate less. They reduce our stress, levels on a very physiological level. It's been shown that time in nature reduces rumination. It decreases our inflammation. We heard Dr. Williams before talking about the relationship between racism and inflammation. And so when we see it that way, social prescriptions don't become just a nice to have if we have time. It becomes our medicine, and it can actually give us the sense that we have more time. You're welcome.
Okay. Opening it up. Do folks have any questions?
Hi, good morning. Thank you, the three of you, for a wonderful conversation. I'm just curious, in terms of building social connections and thinking of access to that network, whether someone, they're mobile or they may be immunocompromised or can't physically join, is there a difference between meetings virtually versus in person, and which would be better, I guess, or ways to work around those different challenges?
That's a great question. It's one I get a lot. I think a couple of things are true. Also, when we talk about social prescribing, it's not just I'm going to prescribe you an art class. We also have to think about, how is this person getting to that art class? Is this a place where they've felt welcome in the past? Is this a place that's going to, support the needs that they might have? So I'll say in the case of Victoria, for example, the woman who was in Toronto and gets prescribed part of this Black social prescribing project, she gets picked up in a limo with her mom to actually go down to this theater for one of the play, which was one of the social prescriptions. In other words, transportation is thought about. But to your second question, also in that chapter, when I talk about why is belonging medicine, I use the example of a program where everything is virtual, with this 92-year-old veteran who hadn't left his home in years because he couldn't. He didn't know how to drive anymore. He didn't have a car. And so what does he get prescribed? He gets prescribed a phone call buddy who calls him once a week and asks him not just, hey, are you still alive? But like stories about his life, stories about his service, stories about what matters to him. And after this social prescription, which by the way, they've been doing this now for about 3 years, the Glenn, the veteran who received this prescription, ends up feeling less lonely, increasing his well-being, motivated to get a handle on other aspects of his physical and mental health that he had ignored previously. So I think that tells us that yes, these virtual connections can be just as good for our health as the in-person ones. It's really more about the quality, right? And the book talks all about what makes a quality social connection, but I think that's part of it. If that virtual social connection is actually giving us a sense of companionship and making us feel more known and seen and heard, then that can be just as effective from my experience. I'm curious if you have a different take, since you're more in the research.
Maybe perhaps a complementary perspective, right? That certainly better than nothing, right? So the nervous system, right? We're necessarily sensory first. That sensory information is kind of like carried in through the spinal cord upwards and does stuff to build a functional brain. So in a virtual setting, right, you're diminishing the expectancy of the sensory input, right? That the human nervous system is expectant. Why is it being outside important? Well, because that's where we evolved, right? Like the expectancy is like a 3-dimensional real life kind of thing. In a virtual setting, right, it's a reduced or diminished to a 2-dimensional, not full body. I often really wonder about the difference in internal state activation between a video screen and a phone call, because not scientifically at all, I find that I'm more emotionally attuned on a phone call than I am on a Zoom screen. I don't know what that's about. But the point being, right, that isolation is bad, right? And what is the access? What are the opportunities? What is the realistic opportunity or solution in this setting, right? And if virtual, right, if for any number of reasons, lots of people aren't able to travel or leave their homes, and so yeah, way better than nothing. Is that?
I definitely agree with the remarks. I would say, I think in addition to the part of the question around accommodations, I think going back to the conversation earlier, I think that could be a key way that these organizations could be involved, right? So if the idea is that you want people to be able to go out in nature more, the infrastructure has to be available for people to be able to do that. And I think a large part of that is directing and thinking about how we can get resources to be able to develop infrastructure so that everyone can participate sort of like in an equitable way, in a way that, like, for example, like if you're saying Zoom doesn't do it for me, it's like, and you want to be in nature and you need accommodations, I think there should be infrastructure that's available to be able to do that. And that could be a way that we could get other sort of like larger organizations that have lots of money to burn involved. I think there was a comment up here, right? No, she'll come. Yeah.
Thank you so much for this. What wonderful work. I was thinking of Dr. Lisa Miller from Colombia, has done some amazing work to show what happens in the brain when we engage in activities such as meditation and in some spiritual connection, right? It's proven that your brain and your neural pathways react positively. And there's this expansion and there's ability to learn new things when you engage in that. And it's this idea of going beyond your environment and the situation and everything immediately affecting you that empowers the person when you go within and you connect with a higher consciousness. And so I wonder if either of you have explored implementing that in your work. Thank you.
Yeah, great comment and question. Thank you for that. Absolutely. And so well timed, because actually one other person I was going to mention in my original remarks is Dr. Ellen Langer, who is a professor here, total, an amazing person, considered the mother of mindfulness. And I think before there was, sort of this buzz around meditation, there was just this idea of mindfulness, the power of actively noticing things in our environment and recognizing the relationship between our environment and our thoughts and our health. She has done some really fabulous research to show, for example, like one of the studies I was going to reference was in nursing homes. She compared people who were in a room where they had to take care of a plant versus where they had the plant taken care of for them. And they found that the residents who had to take care of the plant were more alert. They, had higher cognitive functioning. They lived longer. In other words, this idea of mindfulness, which I would argue meditation is one form of mindfulness, of noticing your environment and letting your thoughts kind of respond to them, really does influence our health. And I think it's something that our healthcare systems need to and are taking more seriously. So thanks for that.
Thank you all. This has been wonderful. This is a question specifically for Dr. Michael. You mentioned kind of early in what you were saying something about the language that we use and the words that we use are sometimes so strange. And people say nobody talks like that. So I've heard you be pretty thoughtful about language and words. And I'd love to hear anything you have to say about what words you think get in the way and take us down the wrong track in terms of the assumptions that we make.
Great question. And like all words have the chance to get in the way, right? So every single nervous system is formed in a very unique context, familially, culturally, language, geography, right? All of these different things. And culture is like this giant current, right? And we're kind of like pushed by that, and we have to try to make sense of all of these different. So in the academy, we use this language called like valence, emotional valence, right? And so through our experiences, not the dictionary definition, but the way that the word is used and the way that we experience a word actually carries like the valence of it, the meaning of it. And all of this stuff happens then, like we compute all of this implicitly. so that we can have the best of intentions about a word. But if I say something like resilience, thinking about it from like a reinstatement of autonomic balance and a flexibility of nervous system function, right? And somebody else is like, people have used that word to beat me up my entire lifetime. I hate you, right? So that's a great question. And so when we're working with community partners, like the importance of just being able to like sit with them and like ask questions. I do, if I don't have an opportunity to do that, if I'm doing more workshop style things, what we do is a tool that I have found helpful, I'll say it that way, is to generate a giant list of all the things we're not allowed to say, right? Like what are all the words that become these flashpoints in conversation that keep them then off the table, but in the artifact of them being off the table, that creates unsafety, or like it increases unsafety for every nervous system in the room when we're not allowed to talk about certain things. So those are the kind of some of the helpful tools, right? Like just kind of listening and trying to get an understanding of somebody else's experience and right. But even like I've used the term autonomic tone, right? Like that is a term that is just not accessible to most people. So it's like, do I have the time to kind of go back and unpack what that means? And so really kind of taking the time, it is time, it is persistence, it's all of these things, to really learn from the folks that you want to be able to engage in dialogue with, to get a sense, right? It's like marketing, right? Like who are you talking to? You talk differently to a third grader than you do to a college students, than you do to community activists, than you do to this room. Is that helpful?
Specific words that you have said, we're going to stay away from this? And do you feel like there's been the attention to language that it deserves?
Specific words that we're going to stay away from. I know that there have been when I've been in facilitating situations where things have come up, and that I do take a moment to be like, I acknowledge, right? Like that's really, really powerful and a little bit bigger than what we have the time to unpack right now. So that's general, like, but generally speaking, in most facilitation settings, right. But this is like the choice, like people have chosen to be there, and generally speaking, they're choosing to stay in a courageous space. But there are absolutely times where you have to be like, ooh, okay. Or like, maybe this is not, we'll come back to that, because our focus is here. And then there was a second part of that. I'm sorry.
Specific words.
Got it. Generally speaking, no. Right. I think, yeah, generally speaking, no. And I think that contributes to a lot of issues or frictions around kind of differences in positions.
Thank you. I think we have time for one last question. Thank you.
Thank you so much for the wonderful presentation. I have two questions, and the first one is more of a systemic kind of question, where I worry that this addressing social determinants of health might get in the way of justice. And it's been said over and over again that we worry that charity would at some point face justice, right? So in terms of addressing that problem, addressing that systemic issue, where do we draw the line? And the other one is, excuse me, in your experience, was there a successful sort of reimbursement of payment mechanism in health systems that was able to make this sort of sustainable? Thank you.
Great.
Two great questions. Thank you for that. To the first one, I think you're absolutely right. And actually, this relates to the language question. And I don't know where Dr. Vish went, but something he said to me once that really stuck with me is even this term, social determinants of health. I say that a lot. I probably said it today. I probably will continue to say it. But I'm trying to steer away from saying it, because what Dr. Vish said to me is there's nothing deterministic about it. Your social determinants of health, it's not just as this is the way things always are, and then your health is always going to follow from this. if we change the underlying, right, social drivers, I think is a better word, then we can change the health too. So I would say that I do get that pushback a lot from when I talk about social prescribing, because it almost kicks it to the medical system when these are really issues of justice and inequity that are so much bigger than that. I would also say this comes back to the broccoli and the kids' food thing, that people are invested in health. People are invested in their own health. They're invested in the health. They're invested in the data of what health tells us. And there have been policy successes that show, for example, when we systemically invest in social prescribing, when a whole population health can improve. And then rather than going through this middleman of the doctor, we should just invest more directly in the sources of community belonging and well-being. There's a great book on this, Dr. Cormac Russell, who talks about this, who's kind of a critic of social prescribing. He says that, the end point of this really needs to be a health-creating community. And I totally agree, right? We need to build directly from the bottom up so that it doesn't have to fall on Kuhn to have PTSD, or it doesn't have to fall on Victoria to be experiencing loneliness. These people should just have access to things that help create their health in the first place. So to your second question about policy, I think it's related, and insurers, because look, insurance companies, I don't get it. Every year when I have to pick my health insurance benefits, I kind of close my eyes and just, eeny, meeny, miny, mo. But at the end of the day, health insurers have a basic incentive to lower the costs of care per patient. And if we can show, and now there is so much data showing that having sources of social support, having activities that give us a sense of joy and meaning and purpose can actually stave off these health conditions that can become expensive down the line, then insurers say, okay, yeah, that seems like a good investment. This might be why some of your insurers might cover the cost of your gym membership or your exercise classes. Now, increasingly, shout out again to Massachusetts, but also in New Jersey, there are insurers like Horizon Blue Cross Blue Shield of New Jersey that are now covering up to 6 months of your ART prescription for this exact reason. They reason that, hey, it might be cheaper for us to pay for your ART classes than it is to pay for your 4 blood pressure medications. So I think, look, we live in the United States. It's not going to be as simple as one authorizing top-down policy, but we're seeing more and more examples of individual sort of community models that are showing this can be done. So thanks for that. Yeah.
Sorry, just a quick thing to add, and I'm sensitive to time, but in the very first part, you mentioned something about charity versus justice.
Yeah.
And so I just want to, so acts of charity, immediate need amelioration. Acts of justice is this more like systemic, lowercase p, capital P, right? And so I think the solution, right, that like acts of charity have proven to not be sustainable or effective, right? That they cost a lot of money and they don't actually get to the root problem. So the awareness raising through science communication, I think, is a critical step to motivate individuals and community members around acts of justice that provide the sustainable supports. And also, right, that I believe that like we as community members also need to remember and remind ourselves continually that we are in fact a part of the communities in which we live. And indifference literally just makes things worse. And so right, like there's a lot of courage involved in these conversations in terms of like knowing self, understanding how position of self, relationality across the community members and structures informs what might be appropriate, what words we can use, what words we should steer away from, all of these strategies. But anyway, long, not short. Right. Acts of charity are, that is, I would say, has typically been a primary strategy and is not effective in the absence of collaborative works of justice to be able to transform people and communities towards wellness.
Thank you. I just want to add really quickly, give my last 2 cents because I can, so I consider myself an abolitionist scholar on many, many things. And so I feel like I grapple with that question a lot of like, what is the line between sort of like navigating sort of the immediate social determinants of health or even structural political determinants of health rather than sort of like focusing on larger sort of injustice. And I think something that I like talk to my students about that, like I will say for my own self as a grad student, master's and PhD, I was very much burn it to the ground. Like, don't talk to me about it. That's really what we can do. And then we'll just like figure it out. And then as I became sort of, right, the person that now has to like teach about it, I think I had to grapple with that in a way that it was like, but there are people inside, right? Like if we like burn it down, there's still like people inside that like through some of these or other sort of like interventions, we're able to like navigate, like helping the people that are inside or impacted by institutional things, while also from a justice perspective, making sure that people don't have to get caught in that system, right? Sort of like over the life course. I think there can be a balance in terms of like thinking about how we address social determinants and social injustice if that intentionality is there. And I think for sometimes we think that addressing the social determinant is addressing the injustice, but I think like having that intentionality that those are two separate things, I think helps with that line that I think that you were talking about. And then I would even say for my own work, to your second question around payers, I think in the models that we have, right, like a lot of social justice work, I think folks want to appeal to a moral value. And I think I heard someone say that earlier, like this morality around sort of what that looks like. But then in a payer model, we are sort of stuck with the cost, right, of like what that looks like in terms of human disease, in terms of human health. And I think from a data perspective, there are people that do that work. And I think there are payers that are sort of showing that they're willing to sort of navigate that, whether the underlying cause is the moral high ground. I think there are payers that are willing to invest in a system where they say, it's probably cheaper for me to do this than it is to do that. And while we may not have the same how we got there, it's still useful that they got there in a way. And so I think that's something that we have to be mindful of in terms of social justice work is like, we may get to the same place. How we landed there might be a little bit different, but like, thank you for coming around, eventually. And so I think with that, I will close. Thank you so much. I really, really appreciate this conversation and all of the questions. And I think I'm handing it over to Emry.
Thank you so much. This was a wonderful first panel to start us off. We are going to take some time for a coffee break. Feel free to stand up, stretch a little bit, and grab a cup of coffee or a snack. It'll be out back. We shall return at 11:50. And one more thanks to our panelists and moderator. We will now transition into our second panel, Flourishing Amidst Climate Change, Promoting Well-Being and Social Justice. Our panelists will discuss methods to thrive and uplift others as climate change alters the world we live in. With the range of our panelists' backgrounds as practitioners, activists, and scholars, their wisdom will inform us how to build capacity through positive psychological, social, and mental health. And they will discuss how to address systemic obstacles to these objectives. May I have our panelists and moderator for panel 2 take a seat. Round of applause to welcome here. Thanks. And unfortunately, we couldn't have Ms. Wawa here today, but we will have our other 2 panelists. I shall introduce them now. Our first panelist is Dr. Elizabeth Pinsky. She is a child and adolescent psychiatrist and pediatrician at Massachusetts General Hospital, where she additionally serves as associate director at the MGH Center for Environment and Health. She's a founding member of the local climate group, Climate Code Blue. Dr. Pinsky's philosophy as a pediatrician involves a strong belief that pediatricians must advocate for public policy that benefits the health and well-being of children. As a climate activist, she believes that policy dedicated towards children's prosperity should focus on reversing climate change and transitioning away from fossil fuels. I guess I got the count wrong because we're missing one of ours. So our actual second panelist here is Ms. Heather White. She is a conservation and environmental policy expert who funded and is the CEO of the nonprofit OneGreenThing.org. Through her nonprofit, Miss White engenders a joyful culture around climate-friendly action, giving rise to a community receptive of climate-focused policy. In addition to this work, Miss White's expertise on climate issues and action have garnered her national recognition as she has served as a spokesperson on news outlets like the New York Times, Teen Vogue, and the Washington Post. Throughout her work, Miss White focuses on encouraging joyful action in the face of eco-anxiety. We are also excited that Miss White is able to join us today as it is her birthday. Happy birthday! And our moderator for the second panel is Dr. Christy Denkla, Assistant Professor of Social and Behavioral Sciences at the Harvard T.H. Chan School of Public Health. Her research focuses on how forms of trauma, such as bereavement, affects health throughout the life course. In addition to her many roles between Harvard, MIT, and Massachusetts General Hospital, Dr. Denkla leads the Population Wellness Lab and Massachusetts, which the Population Wellness Lab investigates how environmental, social, psychological, and biological factors influence how individuals are affected by and cope with loss and trauma. Like before, we will have each panelist share their remarks, and we will have a moderator-led discussion followed by a Q&A. Let's have a round of applause to welcome our moderator and panelists.
Yep. Dr. Pinsky, we'll turn it over to you.
Now, terrific. So it's really nice to be here with you all today. As a child psychiatrist, and specifically as someone who works at MGH, I am very much aware that I am standing on Dr. Pierce's shoulders daily. And so it's just particularly nice to be here to honor his work. I accepted this invitation to talk about flourishing amidst climate change before Tuesday last week. And, you know, we have this tendency, certainly in medicine, and I think largely in academia, and maybe especially here at Harvard, to talk about climate emotions, mental health impacts of climate change, as if we are like observing them, right? Like, this is what the young people are experiencing. This is what the survey data tells us. This is what we know about heat and mood. Is anyone here climate anxious? Yeah. Does anyone here feel that their well-being is being impacted by climate change? And so I, you know, last night I'm lying in bed and I'm looking at the ceiling and I'm like, I'm not flourishing, right? Like, my well-being is not so good at this moment. And I'm meant to get up in the morning and travel across town and talk to these good people about flourishing amidst climate change. And it felt like kind of a tall order, honestly. And so what I said to myself was, you know what, self? Perhaps then what I can say is that I will use some of the strategies that I know, including acknowledging my sadness, my grief, right? Like, I'm scared and sad for my children. And acknowledging that prevents me from putting distance between climate and what it means and sort of my actions and what I'm. What else can I do? I can reframe my sadness and my grief as a different kind of emotion, as an expression of how much I love my children and the world. I can reframe this moment as a moment in history. Think about adversity that our ancestors have faced in the past and sort of reframe it. I can also connect with like-minded people, which I actually, and we'll get to that at some point during this panel, think is probably the most important climate action we could be taking. And I can take action. I can actually haul my butt out of bed and get there. So I don't know if I am flourishing yet. We can like talk at the end of the hour or whatever it is, but I did feel the need to acknowledge that from the outset, because we spend so much time talking about the data and what other people, this is all real for us right now. And so that sets me up a little bit, I think, to talk about climate distress, or, you know, I'm a climate activist and a child psychiatrist. So what people want to talk to me about at cocktail parties and work and lunch hours is eco-anxiety. And so I'm just going to briefly talk about eco-anxiety, why I find it problematic and where it intersects with some of the topics that we've been talking about today, including sort of social inequities. And then hopefully set Heather up to talk about some of the more action-oriented stuff. So people often say to me, I'm so eco-anxious. What is this thing? And like, what can we do about it? What can we do about the kids who are eco-anxious? And like, what's the problem with that? Like fundamentally, what is the problem with talking about climate anxiety or eco-anxiety? Someone. It's overwhelming, very like, so it's anxiety provoking to talk about it. My fundamental problem, one of two, with talking about eco-anxiety is when we talk about anxiety, at least in our culture and sort of our, we are talking about something that's pathological, right? Anxiety is adaptive. It is what we need to identify an oncoming threat and respond to it, right? Like the cave people who survived were the ones who were anxious about saber-toothed tigers. We need anxiety. And in the case of eco-anxiety, it's more than just a necessary emotion. I would argue that it is a moral one. Feeling distressed about the climate and about the future is a sign of, Dr. Pierce would be proud of, attachment, right? Of a solid attachment to the world, to the other people who live in it, to the animals. It is a sign of health. And certainly we know that anxiety is an adaptive feeling, but when we talk about it, we sometimes pathologize it. The bigger problem with talking about eco-anxiety, in my mind, is that it individualizes the problem, right? We can identify a youth who is eco-anxious and their response, their anxiety becomes the problem. Their anxiety is not the problem. Their anxiety is not dysfunctional. The system is what is dysfunctional, right? It is the fundamental inequity in the system that is dysfunctional. The number of articles out there about eco-anxiety that make no mention of the fossil fuel industry drives me up a wall, right? The problem is not anxiety. The problem is that we live in an insane extractive system, but everybody wants to talk about the anxiety, right? Which brings us, I think, to the piece about inequity. We often talk about the inequitable impacts of climate change, and that is absolutely true. Climate change is a threat multiplier that finds inequities in the system and makes them worse, whether we're talking about infrastructure or heat or air quality or any of the things. Climate change makes it worse in a way that is inequitable. But I want to flip that on its head a little bit. Inequity, and specifically racism, is climate change. Climate change is racism manifested, right? Hopkins has a quote: "You can't have climate change without sacrifice zones. You can't have sacrifice zones without disposable people. You can't have disposable people without racism." So racism is the fundamental sort of state that was necessary for us to sort of all live with this, this state, sort of allow it to be. And that brings me back to eco-anxiety, which is one of my other issues with talking about it, is that we know from survey data that people of color, and I'm talking about here in the US, not globally, are much more concerned about climate change than white people are, right? We know that from survey data. We also know that the concept of eco-anxiety does not map onto the lived experience of people of color. It does not resonate. Because we don't talk about, moldy apartment building and my children can't breathe anxiety. We don't talk about eviction anxiety. We don't talk about hunger anxiety. We talk about food insecurity. We talk about things like that. But the notion that the anxiety is a problem, we don't talk about with these, when we talk about these other stressors. And I think there is a way in which thinking about eco-anxiety is really sort of a place of privilege, right? I can worry about climate change because I know that I am relatively safe in an emergency. I can worry about climate change because I know that, my air is relatively clean and the impacts of this are going to be felt elsewhere or by other people. That said, perhaps the biggest inequity in climate change, right, is the intergenerational inequity. So we know that the countries that burn the most fossil fuels are not the countries that are experiencing the greatest impacts. We know that here in this country, the areas where people are driving the biggest cars and pumping out the most carbon aren't the areas where the air is the most dirty or the air quality is the most poor. And we know that the generations most responsible for carbon emissions are not the generations that are going to be experiencing that. And we certainly see that in young people and their level of climate distress globally around the world. And Heather was bringing up the recent Lancet paper looking here in the US, state by state. Young people are very, very worried about climate change. So where does that leave us? What I would say is that we've been talking today a lot about community building and building connections. And fundamentally, we should care about eco-anxiety, even though I sort of have poked some holes in it as a concept, because people who are experiencing mental health harms of climate change, whether we're talking about frank trauma and PTSD related to an extreme weather event, or whether we're talking about people who are just paralyzed by anxiety, cannot participate in climate solutions. So if you are too anxious to do the things that need to happen to fight climate change, that's a problem. If you as an individual or if your community is too traumatized by extreme weather to do what needs to happen both in the event of an emergency, to sort of adapt to what's gone on, or to be able to make the transition that needs to happen off of fossil fuels, then that's a problem. And that's why, despite having issues with the concept of eco-anxiety, I actually think figuring out how to work with it and how to help people take action despite it is perhaps the biggest challenge and the biggest area of opportunity that we have in this space. My time is up. I feel like I was accidentally a downer, but maybe not so accidentally, because again, I said that was how I woke up this morning and where I went to bed last night. So I will hand it over to Heather and we'll—
Thank you, Elizabeth. Thank you so much. Show of hands. If I ask you this question, do you know what it means? What is your Roman Empire? Does anybody, can you, okay. All right. So some of you are aware of this social media trend where it basically is a shorthand for what is something that you think about that's kind of random, but you think about it all the time. More people than you would know think about the Roman Empire, by the way, if you look it up. But for me, it's time travel. Like seriously, I think about time travel about 5 times a day. I think about like, what was it like walking around Harvard 100 years ago? You know, what is the Back Bay going to look like 150 years ago? I came here from Bozeman, Montana, where I live. I think about all the time, what will Yellowstone look like 300 years from now? I think about my ancestors. I think about meeting them. I think about what if I go in the future and meet someone else? And for those of you who are geeks like me and love time travel, you are familiar with the concept of the butterfly effect in sci-fi. It's a horrible film. Please don't ever watch the film. Trust me on this. But the concept is if we go back in time and make one small change, our present day is irrevocably changed. So a small change going back in time would change the present day in ways that we can't even fathom. And we know that this comes from chaos theory. This idea of a butterfly's wing might, in fact, impact our global weather patterns. Now, I am a lawyer, not a physicist, so that's kind of where my understanding of chaos theory ends. But just hold on for a minute, because I think in the climate movement, we disregard the butterfly effect when it comes to our present day decisions. When it comes to the multiplier of what we do today and what impact may have in the future, we tend to discount it. And the reason we discount it is because we start the conversation, and I know we have a lot of systems thinkers here, but we start the conversation with our friends and family about systems change. People like me say, hey, everybody, we've got to scale global climate and policy solutions in the next 6 years, or we can't turn back when it comes to climate. Now, I want you all to know, and you all already know, that is true. But what most people hear, and my background is working on Capitol Hill and in policy as a lawyer, real people is actually a term we use in DC, real people or everyday Americans. When we start the conversation with systems change, they hear, I don't matter. I'm not a Rhodes Scholar like Wawa, who unfortunately couldn't be here today. I'm not a psychiatrist like Elizabeth. I'm not a professor at Harvard and MIT. I don't work for the United Nations. I'm not a United States Senator. I don't work for the EPA. How am I going to make change, especially when it comes to something as large as climate? Here's another error I think we make in the climate movement a lot. In addition to starting the conversation with systems change, which of course we need both systems change and we need individual action. One of the things we do is we start the conversation with the what. Do this, not that. Hi, I'm Heather. I'd love to talk to you about microgrids, and I'm really excited about EV battery storage. I think there's some new technology there. Or we should have the conversation about whether hydropower is really clean energy. We start the conversation with the what instead of asking the most important question when it comes to a sense of well-being, when it comes to our happiness, when it comes to our health. And the most important question we need to be asking is the who. Who are you? Who are you in service? How do you show up for the people you love? What are your strengths? What are your weaknesses? How can you be involved in this movement, the climate movement, which is the biggest challenge of our lifetime? Everyone is welcome. Everyone is needed. This issue of climate is intersectional. Absolutely. And if Wawa were here, she speaks so eloquently. Please follow her at Black Girl Environmentalist, just an incredible resource to understand that the conversation that Dr. Williams led us through today about health disparities is only, as Elizabeth said, multiplied by climate. The people who will be harmed the most have contributed the least amount of carbon pollution. And that is true racially. That is true economically. That is true internationally when we think about the global North and the global South. But it's also true intergenerationally, as Elizabeth said. The majority of today's carbon pollution in the atmosphere was created after 1990. I graduated high school in 1991. My kids and my grandkids, if I ever have them, will experience more and suffer more from climate than I ever will. And that is an intergenerational call to action for all of us. Okay, Heather, thanks a lot. You know, we're all systems thinking here, and you're telling us that that's not, we shouldn't really start the conversation there, and we're all solutions oriented, and we shouldn't start the conversation with the solutions. We should start it with the who. We need both systems and individual changes. We need that. So at One Green Thing, what I realized when I started diving into the mental health impacts of the climate crisis, eco-anxiety, which the American Psychological Association defines as the chronic fear of environmental doom. In my work and in my books, I kind of reframe that definition and say that it's actually an anxiety about the future. And boy, do we have anxiety about the future given the election results just, last week. It is a different world, a new world order that we are all operating in. But what I realized is that we need to give people a sense of agency in this overwhelming issue. What is my role? How do I fit in? How can I help in my day-to-day use that butterfly effect today to create that systems change? So at onegreenthing.org, we have a 5-minute assessment. It's kind of like Enneagram or Myers-Briggs or Strength Finders. And it's an assessment on service. It asks, who are you in service and how do you show up for the people you love? The idea is that there's 7 different archetypes. All of us show up in different ways. So for example, one of the archetypes is the beacon. And this is kind of like when we think about Gen Z and we think about climate justice, the beacon is the person who speaks truth to power. They're the type of person that might organize a rally or go speak before their local zoning commission about an important sustainability issue. Then there's the sage. There was a question over here. I know that was a sage who asked a question about meditation and spirituality, but that the sage is focused on the spiritual connection to nature. And this person may show up very differently. They may take a walk in nature with a spiritual text. They may have a conversation with someone who disagrees with them, but just center that in values. But the point is, we all show up in different ways. And once we can identify what I call a service superpower is, then we embrace a daily practice of sustainability. Now, this is very simple. I just want to let you know, when I go to a restaurant and I'm with my kids and I say, no straws, please. My kids are like, oh, it's so embarrassing, Mom. Like as if skipping a straw is going to make a difference at all. But let me tell you what, the fact that people across the globe have been saying, why do we have all this single-use plastic? Why are we drowning in it? I don't want this. I don't want that. Means that the United Nations is actually considering a global treaty to eliminate single-use plastic. It only happens when we act individually. So this idea of your daily practice of sustainability, what I call your one green thing, that butterfly effect that you're doing today, is that not only are you exercising agency in this overall issue, you can ease your eco-anxiety and you are creating a culture shift. This idea of your daily practice of sustainability, it's not about the math. I just need to be really clear, just like Elizabeth said, the problem here is the fossil fuel industry, right? They actually came up with the idea of the individual carbon footprint calculator. That is a PR gimmick from the oil and gas companies. They wanted to shift the burden to us individually. Don't fall for that. But the important point of your daily practice of sustainability is that we are all culture change agents in our families and in our communities. And we learned from this presidential election that culture is not celebrity. We learned that random people knocking on your door or sending you text messages is not going to convince you to change your behavior. But what we do know from individual psychology, peer-reviewed scientific studies is that if you connect a behavior with your identity, you're more likely to choose that behavior, which is why there's a power in initializing your service superpowers. So with this idea of finding out what your strengths are in climate service, embracing this daily practice of sustainability to ease your own anxiety, to shift the culture, because we need that culture shift for these big policies and global solutions to work, you are in fact jumping into that butterfly effect. And then just very quickly, I think one of the things we have to address is burnout. People in this room who have been researching, who have been talking about social justice, racial justice, health disparities, it is exhausting work. And I need to let you know the next 4 years are going to be harder than we ever imagined. We must hold on to each other. We have got to focus on community. We have to focus on our state governments, especially. And just here, 5 quick tips. 1, rest, rest, rest. And I'm going to ask you to rest and take an active recovery in nature. We've already heard from Dr. Michael about the power of time outside in nature, hundreds of peer-reviewed scientific studies that show that time in nature reduces blood pressure, reduces cortisol. The second thing I want you to do, of course, is to find your climate superpower. The third is to connect to community. I love this idea of social prescribing. Thank you so much, Julia, for this idea of the power of community. And then I think it's also very important, and this is me being super practical lawyer here, is be prepared. And I'm going to wrap up in just one minute. Be prepared. Get your go kit ready. Seriously, the Red Cross has been telling us this forever. Memorize your friends and family's phone numbers. Have your documents where you need it. Know where you have 2 weeks supply of medicine, and be ready to go if you need to evacuate. Because the reality is that none of us are safe when it comes to climate. We saw that with Hurricane Helene, and we saw that with Hurricane Milton, and of course the wildfires that we see routinely in the West. And then just finally, I would say is embrace that one green thing, because every conversation, every action, everything we do today, we do not know the impacts that it can have in the future, because we are the architects. We are the architects of the future. And together we can help build a greener, healthier, more just future. Thank you.
Thank you, Heather. Thank you for inspiring us. Elizabeth, as you've been listening, I'm assuming you've had some thoughts and some reflections on what Heather shared. Would you like to?
Thank you for
comment?
being the counterpoint to that was terrific. I'm struck in particular. We both touched a little bit on sort of community and community building. I would love to hear like a little bit more from you about how to intentionally do that, and whether you have thoughts about sort of how, to me, finding a community, for me, that was my activism group, Climate Code Blue, which is a group of physicians in the area, is absolutely a source of sort of sustenance and support for me. Do you have practical tips for people about how to identify that community if we do think that that's one of the most important elements of taking action?
That's such a great question, Elizabeth. I think it starts with your own sense of purpose and your own sense of how you want to contribute and show up. If you are, for example, what I would call a sage, you might really enjoy connecting in a community garden and volunteering, and literally you can just show up in the community garden. And I'm going to tell you right now, we all know the studies, and I love that you mentioned Ellen Langer. Eventually, is just this idea of gardening. There's all kinds of wonderful research out there that it helps with mindfulness and it helps this sense of well-being. So that might be a path. If you're a wonk and a policy nerd like me, you might be really excited about Project Drawdown. Project Drawdown has a list of all these phenomenal climate solutions. I will tell you, when I told you, this daily practice of sustainability isn't about the math. Well, Project Drawdown says if we all do it, the math actually matters. Individual and household actions, reducing food waste, becoming more energy efficient, recycling, which a whole nother thing we could talk about. That's a whole nother day lecture about recycling. Recycling your metal and aluminum is really important, but that can actually contribute 25% of the carbon pollution reductions we need. Household and individual actions can. So the idea is there are all of these community resources around there. And for most of them, you literally show up and volunteer and reach out. But it's really about how do you want to show up and how do you want to connect?
Thank you. Dr. Pinsky, I'd love to hear your thoughts on the context of this conversation from the global perspective of taking action, understanding service. We know these things are helpful for mental health, physical health. But how do you think about this as a child psychiatrist trained in sort of a model of this idea that there is maybe clinical pathology that can get in the way of taking action, that can get in the way of being in service? And what would you say to people who might encounter or be questioning the opportunities or the possibilities, or even figuring out how to differentiate who is capable, like if there are impairments existing that are interfering in this ability to take action?
So I think the question is a little bit around sort of by impairments, we mean actual anxiety or depression or sort of actual pathology. And the Dr. Denklin knows better than me, sort of the evidence is emerging around people who have climate distress and how that relates to what we would call actual anxiety, like clinical anxiety, clinical depression. There are a few rating scales that exist now to look at climate anxiety that look at either functional impairment or sort of degree of emotional impairment. And as the scientists in the room, if you can't measure it, you can't, come up with interventions or sort of think about how to work with it. So that has been an important development. And then there's very new and emerging data around activism, but specifically collective activism as being a mediating influence on climate anxiety being related to sort of more impairing emotions, whether it's anxiety or depression. And that people who take action do feel better, specifically if they take action in a group. That sort of is the special sauce, that people aren't doing things on their own, but that they're working with other people to sort of help sustain their action. So that would be one thought that I have, that if you do think, for example, and that data specifically in young people and young adults, if you do have someone who you think is impaired by their climate distress, on the one hand, you could say, what is the appropriate level of distress in the face of like existential risk? Okay, too worried? Well, if you can't go to school and you can't work and you can't have meaningful relationships and you're really spiraling, yeah, maybe you can, because that's not of use to the world or to service or to yourself to feel that badly. That collective action can be helpful in that scenario. So I don't know if that gets at the question. I guess the other piece of it that I would say as a child psychiatrist is that we are just always thinking systemically, as everyone here has all day. And that, again, talking about youth climate anxiety has become like kind of popular. We hear about it a lot. It's in it's in the newspapers, it's on the news. Children and youth exist within systems, and we can't think about any child or any young person outside of family, community, neighborhood. And I really do what I said earlier, that any intervention that strengthens social connectedness is a climate intervention. We think about climate solutions as being either mitigation, reducing the amount of carbon that we're pumping out into the atmosphere, or adaptation, improving our ability to adapt to the changes that are already inevitable. It's social connection that predicts how well people do in the wake of a disaster. Not FEMA, not the federal government, none of that. It's whether you are connected with your neighbors and whether you can engage in mutual aid. And we know that people who care about their neighbors and care about the world are more engaged in climate action as well. So that's what I meant in terms of anything that improves social connectivity is a climate intervention, both for mitigation and for adaptation. I think I got off course there, but
No, thank you. I think I see Heather nodding. Would you like to reflect?
I'm just agreeing with everything that Elizabeth said. Like it's social connection is so important. Community is so important. I think again we learned this on last Tuesday about how we need to start having these intentional conversations in our communities with our family, with our friends. If we have people, we need to diversify our social algorithms to understand where other people are coming from. And sometimes it's healthy to engage, sometimes it's just not. But that community connection is going to get us through, and it's going to get us through this next 4 years for sure.
Thank you. So in terms of getting through the next 4 years or looking forward to the next steps, you've already both remarked on tangible, pragmatic steps that we know are protective, might not help us flourish, but might help us engage in pro-social behaviors that we know are protective, like collective action, like social support. So now if we think more about what can be done in addition to the things you've already mentioned in terms of policy, in terms of advocacy, Wawa, I know can't be here, but I know she was traveling here from Nairobi, and I lived in Nairobi for 3 years, so I might be able to offer a little bit of flavor of what she might have brought from Nairobi. I was there when the government initiated a nationwide ban on plastic bags. So really, in a very brief amount of time, plastic bags were outlawed in Kenya. People used plastic bags, not just for, items, but also for other use, like for drinks, for carrying liquids. Plastic bags were often recycled and used many times over. And so a consequence of the ban was that there was a reduction in trash, which was excellent. But then people could be fined for using plastic bags. And if we think about sort of things like the fundamental cause theorem, or we think about this whack-a-mole approach to how social inequities can repeat themselves just in different ways in a system that's structured inequitably, this idea that the people who were fined for using plastic bags needed to use them for their livelihood. And so it disproportionately affected the poorest people. And it was an example of this perpetual kind of inequity that was reproduced by a intervention. So I have that as one cautionary tale, but I'm always thinking very cautiously and thoughtfully, or as much as I can, about the policies or the ideas we have, and do these stand the possibility of perpetuating inequity? So I'd love to hear any of your thoughts on examples of this. How would you caution, say, a policymaker or someone asking for your advice on considering the multiple consequences of any particular intervention in terms of the potential consequences for potentially perpetuating inequity?
I think that's a great question and a very good example of the unintended consequences, right? I think though, I can't underscore enough how we are in a new world order right now. Our policy is going to be trying to hold the line and defend. There's not going to be a lot of conversation about innovation. That said, my small town of Bozeman, Montana passed a plastics ordinance where we just did a plastic bag ban. And I'm sure you know that there's states around the country that have passed laws that prevent the banning of plastic bags. So it's an anti-ban law. it's hard. It's complicated. I think you have to try. I think a lot of times what happens, especially in climate, for example, EV cars, where are we going to get the rare earth minerals for the EV cars? And that's a reason to hold up progress. And so there's all kinds of economics, cost benefit analysis that you can do. At some point, you have to take the leap and try it and then be able to reverse course. I just need us all to really, it's a reckoning that we're dealing with right now when it comes to climate, and we're going to be out of the Paris Climate Agreement. Although I did see a headline right before this panel that the head of Exxon, the CEO of Exxon, just asked President-elect Trump not to get out of the Paris Accord, the Paris Agreement. But he may still do that. I think he likely will. So it's just like when we're talking about, the climate is an existential threat. You can call it climate resilience. You can call it climate justice. You can call it extreme weather emergency preparedness, whatever language, because I think there was a conversation earlier about what language whatever language this administration is using, the threat is still there and it is only intensifying. So I think that's a great example. There are all these unintended consequences. Boy, do I hope we try some progressive policies. I think it's unlikely. That's my downer, Elizabeth.
Well, see, that's good because now you're the downer and I'm going to be the upper. We're like trading back and forth. I like this. I do. So you were in Montana. We are in Massachusetts. And I don't want to paint an overly rosy picture because I fundamentally agree with Heather that we need to really gird our loins for the next 4 years. I do think that we are positioned here in Massachusetts to be an example and a laboratory for how it can be done right and better. And in terms of our current leadership here, people probably know we now have a statewide climate chief, Melissa Hoffer, who's working on these issues. We are making progress in a way that is not always equitable and is certainly not always perfect. But I think that one of the sort of stopgaps we have in place against unintended consequences is involving frontline communities and frontline organizations as much as possible in the planning. There's been legislation here in Massachusetts, energy facilities siting board reform, sort of reforming what, we're going to need to electrify everything. Where is that infrastructure going to go? And is it going to be closer to the communities in greatest need, or is that going to place them at increased risk in the event of a disaster? These are really rough decisions that need to be made, and that I am hopeful the state really intends to try to make with the stakeholders who are on the ground, who are on the front lines, as much as possible. We have to electrify everything. That means that people who continue to use gas are going to face higher and higher gas bills as we transition over. How are we going to deal with that? There's super creative solutions that are coming out of Massachusetts, out of policy nerds here to try to figure that out, try to figure out how to tether electrical rates and gas rates as we transition off of one and onto the other. As I have tried to talk to my own children over the last week about why we're not doomed, one of the things I've talked about is the fact that there's a lot more than the federal government that makes decisions. And there's a lot more sort of players in the United States than just what's happening at the federal level. I do think we have the opportunity here in Massachusetts to continue to make some progress. But that's going to mean that we need to continue to demand it and to push for it in the face of the loss of funding and loss of hire, all of the things that are going to happen for the federal government. We have to make clear that it is still important to us here, even if it is at greater cost to us as citizens of the state. So I think there's still opportunity.
Thank you. I'll ask one more question to you both and then turn it over to the audience for questions. In joining this panel, I've been reflecting on the life of Chester Pierce, as many of us have here. So Dr. Pierce was a psychiatrist and became board certified in the American Medical Association at a time when Black physicians were not eligible for admission to the American Medical Association. Yet, he had a tremendous impact on our scholarship and on our thinking about psychiatry and health and inequity. A legacy that has touched many of us, as is a testament to this symposium today. So the question then is, in the face of the many barriers we might experience in taking action or understanding what the best action might be, I love that you brought up community-based or community-engaged research, participatory action research, research that begins with an assumption of justice and equity and then builds the design or the intervention from there. So I'd love both your thoughts from your perspective expertises on opportunities to engage in collective action or participatory community building as to address some of the things that you're seeing are the most pressing kind of conditions in your, either in your, say, your practice or in terms of thinking about mental health or in your advocacy. Heather, do you want to start?
Yes, thank you very much. I was giving a talk to a bunch of fifth graders last year, and I'm not smarter than a fifth grader, just to know. And we were talking about the United Nations Sustainable Development Goals. And for those of you, I'm sure you're very familiar, but it's like 2030, we're going to end poverty. 2030, clean water for all. 2030, clean energy for all. And this 10-year-old was like, we're not going to meet these goals, right? And this 10-year-old also asked me the following question, and this does relate to your question, just so you know. The question was, is there a virtual reality experience where I could step into a world where we meet the 2030 UN SDGs? Because I cannot imagine it. I have no idea what a world would look like with gender equality for all. I have no idea what it would look like with clean energy for all. Can you help me see that? And I think that that is our call to action for community organizing. That's when we need to reach out to the artists, just like Julia was saying. We need to reach out to the technologists. I'm so cringy to my teenagers. I've been researching solar punk and hope punk and just this idea of future and futurism where we have, green design everywhere, where we have health systems, where we design for, equity, where we have solar gardens and rooftop gardens everywhere. What does that greener, healthier future look like? Because it's on us to imagine that future working together in communities and helping kids see what's possible, because they get the apocalypse. That is not hard. Like the zombies are on their way, right? Like that is easy for them to imagine, but the alternative, there's not a lot of narratives out there that are mainstream. And I think that's a call to action for all of us.
And I saw a 10-minute sign, so I will just say really, really quickly, are people familiar with, and I'm going to get back to Chester Pierce, I promise, but are people familiar with the notion of meaning-focused coping? Is that like a term that means anything to people? So meaning-focused coping, it actually comes out of the work of Susan Folkman, somebody who was working with people who were caring for terminally ill spouses and sort of how they coped. And so it's a type of coping that relates to a bad situation where you need to continue to function and you don't know what the outcome is going to be, and the outcome is not necessarily going to be a good one, right? Sound familiar, right? And it has to do with drawing on your deepest sort of goals and faith and hope and sort of understanding of the world and sometimes the greater historical context. And there's a Swedish psychologist, Maria Ojala, who has looked at meaning-focused coping in kids. Okay, so there are problem-focused coping kids who are worried about climate, who like do a beach cleanup or start a group at their school or like change the light bulbs. Right, they're problem-focused copers. There then are emotion-focused coping kids who use sort of like journaling or talking or denial, which is a fantastic coping strategy for climate change. Right, if you just believe it doesn't exist, you feel awesome about it. Right. Okay, so there's emotion, and then there were meaning-focused kids who sort of thought more about the bigger picture. And she looked at these groups of kids. The problem-focused kids were more active on the environment, but they still sort of felt like crap, right? The emotion-focused kids felt great, right? But they weren't doing anything sort of pro-social for the environment. And then it was the meaning-focused kids who were sort of like the Goldilocks, right? They felt a little better, and they were still active on the environment. And I just wanted to say that meaning-focused coping is something we haven't talked about at all, but that I think is important to hold on to And it relates back to Dr. Pierce, because when I am in my darkest moments, I think he died in 2016, which I was in my, I guess, second year of adult residency. I don't know. I was in training at MGH. We overlapped in our lives, and he could not join the AMA because he was a Black. Like, it's bananas. And we can't, it sort of gives me a sense of humility that as dark as things are now, and as hard as it is to envision placing myself in that historical context and knowing how much things can change and how surprising things can be just in a lifetime, that's my form of meaning-focused coping. So I didn't answer your question at all, but that felt like a place to end.
Perfect. Perfect. Thank you. So open it up to questions from the audience, and then we'll save some time for folks online. We have a circulating microphone.
Hi. How can I say this? Can I have permission to be a devil's advocate? I've been to climate tech at MIT. I've been to a lot of things, related. I'm very concerned. I have an electric stove, not a gas one. I do all the usual things. I used to recycle until I found out they don't bother to recycle. But I go to these events and nobody brings up the elephants in the room. Nobody talks about all those private jets I see flying and parking in for the the World Economic Forum, or the multi-gajillion, $500 million yachts that people use, the top 1%. Everyone excludes like the wars and the effects from the military industrial complex. I am beginning to lose my meaning, focus, whatever you call the coping. I'm beginning not to care. I feel bad. I don't share it. Unfortunately, I don't have children. I don't have to worry about it, but I'm just saying, why should I recycle? Why should I care? The people in power, the people who supposedly the leaders, don't give a damn. Why should I? I don't care anymore. Not that I don't really not care about my community. It's not like I litter and I, setting bonfires and things like that. But I'm on the grander thing. If I see other people saying, do as I say, not as I do. For example, what was it years ago? Al Gore, when he was talking about his stuff, I'm like, he lives in his mansion. All the people have led their mansions. They have 2 people in and 40. Not to say nothing against mansions, but meaning they're using all the energy. And do you get my point? Why should I care? Why? No one talks about the wars. No one talks about the effects of these. Nobody's bothered to have anybody else to change what they want to do, but they want me to do it as a community person.
So this is my dinner table conversation at home. No, seriously, what you just said is what we saw in the Lancet study that Elizabeth mentioned of 16,000 young people in the United States. 85% experience eco-anxiety, and more than half do not want children of their own. More than half because of climate. And this type of hypocrisy just really frustrates them. I also, just going back to last Tuesday, think that we saw that. We saw that with the Gen Z vote of just a lot of frustration of just saying, look what you're leaving me. I, of course, disagree, have a different perspective, but what you say is what we hear from young people all of the time. What is the answer? It's about inequity and it's about our systems. We have to take care of each other. We need economic systems that allow us to do that. We need to figure out what those systems look like, where we center equity and we take care of people, where everyone has a right to education, everyone has a right to a house, everybody has a right to healthcare. Those are important conversations we have to have. We know the day after the election, the world's richest people, I think it was like something like $50 billion. I don't know. Their wealth all increased automatically. The only way through, though, is community and actions and our own intentions. It's the only way through. But I get it. People are tired. They are exhausted. They are exhausted whether you're dealing with health disparities, where you're dealing like every day. Dr. Williams talked to us about the racism that people have to deal with every day. This idea that when Black Americans or anyone who's Black really goes to sleep, that they have increased blood pressure because of that constant barrage that they're dealing with. People are tired, people are exhausted. And so my answer is rest. My answer is to express how you feel. And my answer is to keep on going in the way that feels authentic to you, because that's the only way forward. And that's what I tell my teenagers. And I have to tell you, they're kind of like, thanks. But that's what I say.
All of that. And I do think that one tool that I have left, even when I feel that way, and I feel that way sometimes, is my rage. And I do think that there is, it is not, I think sometimes the burden of, I completely agree, individual action and collective action. Collective action is just a whole bunch of individual action, right? We need both. And I think sometimes the burden of individual action can be a barrier to systemic or collective action for this very reason, because people feel like, I can't afford an electric, I can't do this, I'm using the straw, I still want my hamburgers. People get overwhelmed by what they need to do individually. It is not your fault that it is cheaper to fly to Florida than it is to take a train to New York City, right? Like, that is the system's fault. It is not your fault that it's so expensive to make the individual changes that we need to make in order to address the climate crisis. It is not your fault that we're all like wish cycling and that it's all just going out to a, barge in the ocean or wherever it's going, right? So what I think we saw last week was rage at the system. It was misdirected rage, in my opinion, but our collective rage as individuals is powerful and can affect change. I don't eat the burgers, screw the recycling. I'm glad you have the nice stove. It's better for your individual health anyway than the gas stove was. So that's a win-win. But when I feel that way, what I do is I try to focus my energy on the system.
I think I would just add too, is that that's where this positive vision, like what's it all for? We need to start really talking about what that looks like. What does the systems change look like? I think that's an important part for all of us.
To that, I will just add to that. I talked earlier about sort of racism and inequity being the like kernel at the center of the climate crisis. The flip side of that is, imagine how just the world is and how much better it is in every way if we do the things we need to do to solve the climate crisis. So when I feel hopeless about climate, I can at least center myself on that and on like justice being the necessary condition for us to have addressed the climate crisis.
Thank you. Another question there. Well, the microphone travels to you. I will join in the invitation to envision a magical future, which is that all the wealth is redistributed. So what if the billionaires, what if all of that wealth was redistributed to every single person on the planet? I would need help from a mathematician, but everyone would probably become a millionaire. Every single individual on the face of the planet would be wealthy. So that's for you.
I like your style. My question is, thank you so much. And sort of like building off the last question and thinking about social justice and your responses, how do we think about that globally? So one of the comments that you made earlier, Heather, was about this idea that like, we're thinking about sort of electric, right? Like this wave of electric, but then it's like the mining, right? And I will say I'm too, like, I got an electric vehicle and then I found out about the children in the cobalt mines and felt terrible about myself. And so I'm curious how you balance this idea of like global equity, right? Because also the children that are mining in sort of these cobalt mines are also not contributing as much, right, to this idea. So how do we balance this idea that even in our efforts for equitable and sustainable sort of like environmental solutions, there's still injustices that are happening? How do we balance that sort of like globally, not just domestically? Because I think oftentimes when it's out of sight, out of mind, and it's other people's kids, we don't want to think about that, but like other people have dinner conversations with their children around the environmental context outside of the United States. And so I'm curious, like, how equity shows up in your work in that way. And then how, I think, to Dr. Pinsky, like, how do you think about that also in terms of like what you were talking about around this? I'm going to get this incorrect. The moderate, no, the last one that, yes, thank you. The mindful sort of like solution rather than like emotional versus action, right?
For the global context, COP is happening right now. The Convention of the Parties and the United Nations are supposed to be talking about climate reparations. That needs to happen because in addition to EV, you just gave the example of EV, but we also have a situation where Nigeria is like, seriously, you don't want me, you don't want our country to benefit from oil and gas when that is what we're rich in. And we've had, because of colonialism, all this extraction, but now we don't get to keep the wealth here in our own country. So there are serious issues of equity, and we have enough money. We know we have enough money. The problem isn't money, it's how it's distributed. So climate reparations is really, really important. I don't know what happens to that conversation now. I really don't. As far as with respect to EV, we're going to get it wrong. Right. And we have to call it out when we see it as we learn and say, we have got to figure out not only rare earth minerals, but how, our clothes are made, how our cars are made, where they're made, and those impacts. We need to start having that conversation to envision the change. It can be overwhelming. And a lot of people get that freeze response. They go into denial, like, I can't do anything right, so why even try, which we just kind of already heard. I know this is so cheesy. And it's okay if you roll your eyes when I say it. Seriously, it's okay if you say, we have to try our best. Like, the answer is to do something. And then we see this injustice. We have to try to correct it and do all that we can. But the answer isn't, the answer isn't more fossil fuels, because we know they are finite. They are finite. It is like saying to the world, what we really need to do is we need to invest in VHS tapes. You got to get your CDs. We're just going to try to get as many CDs as we can because it is a finite resource and it's causing us harm. And there are all these complexities, but the answer isn't inaction. The answer is action and then fix it later. I know that seems trite, but unfortunately, I feel like that's kind of where we are.
And I think the specific question to me was around meaning-focused coping and sort of thinking more globally. I don't know if I have a good answer for that. Because I work here when I'm working with kids and young people directly. I do think that, like Maria Oyala's work and Susan Folkman's work, that'll help happen here in this sort of larger cultural context. We certainly know that here in the US, there are indigenous cultures that do meaning-focused coping a heck of a lot better than sort of the model that I grew up with, where it's sort of baked into the culture. I think probably you can practice meaning-focused coping anywhere and in any context. But I don't know that I'm informed enough to give a good example from the global experience.
One more question, and then we'll ask the folks online. Thank you.
Thank you. I thought I'd try to bring and maybe it's a good thing it's the last question to have like a more positive kind of end to it. I was born on an island in Africa, so climate change for us was a reality way, way back before it was even trendy to talk about it. And I hear it, like we're now hearing that the United States is going to withdraw from COP, and that's going to send a whole wave of another dimension in the negotiation. Everything is going to change from now on. But from having heard my different friends here, I think we must not forget that there is so much power in numbers, that even though we have politicians and governments doing things, and this is what we have learned when we are, when you grow up on an island, climate change is like, I don't even know whether my country is going to exist in 50 years, right? That's where we are. And I hear it. We are all burnt out. I myself work a lot with mindfulness. And in addition to nature, I've learned the power of just breathing. And I did not know that. I learned that from my friends at the Divinity School. But what I want to say is we just, in those times where it's just so hard, where you're like, why am I sacrificing myself when the people who have the power to make an impact are just not. And my little thing is just going to be like a drop in the ocean. But if all of us do it, we have the power to send a wave in this whole ocean of things. And that's when we can be ignored by the government, by anybody else. And in fact, we're the ones who will generate that change, not them. They're just, if we let things go, they will just keep going and they'll be happy flying their private jet or doing whatever they want to do. So I think the lesson that I have learned from being born on an island and what I've learned from my American experience, because together that's where I get my energy, is we just need to rely on one another. And that's 1 + 1 will make 1,000 eventually. So that's all I wanted to say. Thank you.
I would like to invite you to dinner to my house in Bozeman, Montana. Thank you.
We'll hear a couple questions from the folks online.
Yes, so we do have some questions that came in from our online viewers today. One that some are very related to what we've discussed so far. One that brings up a new topic that I think would be helpful to hear some thoughts on is one of our guests is interested in advice to help managers who face eco-anxiety on their teams, given that it feels very politically fraught, but people are anxious and impacted directly. So how to manage that as a manager on teams?
That's a great question and very timely, because I would say it wouldn't seem that political just a week ago, but now it may. What I have heard from folks is that the anxiety is real in the workplace, and the natural disasters we've experienced just here in the United States alone are real. And so I would say that even if it seems politically fraught, it actually is not. We know that from the survey that we were just talking about with young people ages 16 through 25, 85% experience eco-anxiety. So I would encourage managers to create a space for people to share. And then I would offer, after holding space, and one of the big takeaways I always say to people is, ask the young people you love how they feel about the future we're leaving them. And to most people who even don't consider themselves environmentalists, it's really a game-changing conversation for almost everybody to a person. So creating that space, using things like our friends at the Climate Mental Health Network have a wonderful tool that's called the Climate Emotions Wheel, because people feel betrayal, people feel anger, people feel sadness, people feel worry. There's a concept called solastalgia, where there's a loss of place for the future, like the island that you grew up on, the country, may not exist anymore. There is that. So experiencing the range of emotion and then talking about what you can do in your workforce to support well-being. And that can be everything, even though, again, some people will say it seems trite. It can be community garden support. It can be talking about composting. It can be talking about energy efficiency, how you're managing your buildings, and it can be offering service and time for people. I think the other thing is burnout is real. It's real. And there's a lot. We talk about the poly crisis that we're dealing with. It's a lot. And just acknowledging it goes a long way for people, and creating actual opportunities for rest.
I agree with all that. I would also specifically point people towards the website of the Yale program on climate communication, which has a ton of survey data on public opinion about climate, specifically here in the US. And they talk about sort of the pluralistic ignorance around climate change. The fact that the vast majority of Americans believe that climate change is happening. Most people believe it's related to human activity, and everyone underestimates how likely other people are to hold the same opinion. So they've been tracking this now for I think 15 years, maybe even longer than that. And it's the same 8-9% of people who are truly dismissive about climate change. Less than 10% of Americans are actually it's not real, it's not happening. The fact of the matter is that the big in between is people who know it's happening, but who maybe don't know how urgent it is, or who know it's happening, but feel like it's not the biggest problem that they have right now, so they can't think about it. So just all to say, I think people fear talking about it maybe more than they need to. And that 8-9% of people, God love them. We don't need them. We just need to take the people in the middle and get them to be taking action. I would not waste time trying to convince people who don't believe in climate change that it's real. Doesn't matter. Don't need them.
absolutely agree with all that. And I would just add to it, onegreenthing.org. We have a really interesting, I think it was, what was the collective coping you were talking about? You just used the term. Meaning focused coping. We have a fun exercise that's called Be an Awesome Ancestor. And it's this idea of thinking about someone who has made the life you're living possible in your past. And then you envision what 2030 could look like if, we do accomplish the SDGs. And then you sit down and it's 2050 and you're the ancestor and you're talking to a teenager. What are they going to thank you for? What are they going to wish you had known? There's all kinds of fun exercises that we have like that, in addition to finding your climate superpower and your own unique way to show up for the movement. And that's a nice tool for people too.
Thank you. One other question we want to get to from our online audience, given that there's been so much conversation about the impact on young people specifically, this one participant is interested about their young daughter, who doesn't quite understand the concepts of carbon footprints, net zero, and sustainability yet, but wants to start having these conversations with their particular daughter. So any recommendations for how to have these conversations with children?
Yeah, so it depends very much on the kid's developmental age. So I don't know how old this kid is, but obviously the conversation that you have with a 3-year-old is different from the conversation that you have with a 7-year-old is different from the conversation you have with a 13-year-old. And probably the 13-year-old should actually be talking to you, not you to them. I think I think of climate change as being a conversation like race or sex or any of the other important stuff that you want your kid to hear about first from you, so that you know they're getting good information and so that they know that you're a trusted source on it. So I think, Harriet Sugarman, who wrote the book, How to Talk to Your Kids About Climate Change, right? It's the name of the book. Her first rule is tell the truth. And in general, you should tell the truth to your children about all things. But that is especially true with hard things. But what truth is appropriate really depends on the kid's developmental age. So, when my kids were very little, we had a tradition that if we were going on a hike or if we were walking on the beach, we always brought a bag with us and we collected trash as we went. Little kids really like sort of mastery and doing things and sort of can feel very connected to nature. And often it's about animals, things like that. A simple, developmentally appropriate description of climate change. The NPR Life Kit also has something for tweens. It's like a zine that's called, do you know the one I'm talking about? I'm blanking on the name of it, but if you did NPR Life Kit Kids Climate Change, you would find it. But a really simple, developmentally appropriate description of, we burn gas and oil to make electricity, to keep our houses warm in the winter and to drive our cars. That is wrapping around the earth like a blanket, making it hotter. That's causing a lot of problems for people and for animals all over the world. There are lots of smart people who are working on it and trying to find a solution. And we as a family should be, doing what we can in our own way. That's developmentally appropriate for, I don't know, a kindergartner, and would be a place to start.
Well, thank you. Thank you so much. I think we're at time. I've learned so much from both of you, and I know the audience has. And again, thank you for your time and your remarks. Very much appreciate it.
Thank you all so much for helping us with our second panel, sharing your wisdom and helping to broaden our approaches to thriving and being climate active. Let's give another round of applause to them. We are now on to our third and final panel, Happiness in the Workplace, Cultivating Positive Work Experiences Through Innovation and Leadership. In this panel, our panelists will bring insights for how workplaces can develop their spaces to be inclusive, supportive, and energizing. With their specialties, our panelists will suggest best practices that center equity and innovation, as well as how leadership positions can be utilized to inspire workers to participate in and benefit from these practices. Once again, we will listen to our panelists' remarks and have a moderator-led discussion followed by a Q&A. May I have our panelists and moderator for panel 3 please take a seat up at the front. Again, let's welcome them with a round of applause. Our first panelist is Dr. Glorian Sorensen. Dr. Sorensen is a research professor of social and behavioral sciences at both the Harvard T.H. Chan School of Public Health and the Dana-Farber Cancer Institute. She is the founding member and co-principal investigator for the Harvard Center for Work, Health, and Well-Being, which has been funded since 2007 by the National Institute for Occupational Safety and Health. Her research is characterized by a systems approach that puts theory-driven workplace interventions to the test, identifying ways to optimize work organization while prioritizing worker safety, health, and well-being. Our second panelist is Jonathan Isaacson. He is the executive chair and CEO of the GEM Group, commonly known as GEMLA, a multi-award-winning corporation which supplies businesses with high-quality products that support workers, such as bags, stationery, electronics, gifts, and more. With his experience in business leadership, Mr. Isaacson provides consultation in multiple advisory boards, including institutions like University of Michigan and Brigham and Women's Hospital. His community engagement through Gemline and beyond has earned him awards such as Counselor Magazine's Person of the Year in 2021 and the Making a Difference Award in 2022. And our moderator for the third panel is Dr. Erika Sabbath. She is a social and occupational epidemiologist who serves as an associate professor at the Boston College School of Social Work and as an adjunct associate professor at the Harvard T.H. Chan School of Public Health. Dr. Sabbath's research investigates how workplace policies and practices influence population health disparities among working and retired populations. Her work in this field has earned her awards such as the Early Career Achievement Award, and she has also published her work in journals such as the American Journal of Public Health and the International Journal of Epidemiology. Her work continues to promote supportive, safe, and health-promoting workplace structures. Please join us in a warm welcome to our moderator and panelists.
On to start. Does this work? Great. Okay. Welcome, everyone. This is great to be here. We're really delighted to be part of this panel today. I believe that our Center for Work, Health, and Wellbeing has a lot of overlapping interests with the Center for Happiness. And in fact, as I'm going to mention, we'll mention at some point during the panel today, the Center for Happiness has actually funded some of the work in our center, contributing to how we look at thriving from work. So I'm really happy to be here because I believe that work can be an incredible source of happiness and thriving. In fact, we know that work contributes to a lot of well-being, a lot about well-being, a lot about life satisfaction when we look at it as a source of meaningful work, a source of income and benefits for our families and for workers, a source of social connectedness with our peers and our supervisors, and the kind of general sense of control and meaningfulness that one can get out of work. So why is it then that we see so much sense of stress in the workplace? And we hear about that so often. In fact, I have a couple of statistics I just want to read for you. 76% of workers currently report at least one mental health symptom. That's from the 2022 Surgeon General's report on mental health. 84% report working conditions that contribute to poor mental health. 81% report that they're looking for jobs that would support their well-being. So what we try to do within the work of the center, our center, is to really understand what are the underlying working conditions that are contributing to these poor outcomes in terms of thinking about stress, psychosocial factors, poor mental health. What is contributing to that? So there's a lot of literature in the field that's really looking at working conditions, whether we're looking at the extent to which a person has control and decision-making latitude over their jobs, or the nature of their work hours. Do they have flexibility and control over their work hours? Or is there predictability in their work hours? We actually see that there's a variation in terms of what matters to workers, whether it's flexibility or schedule control, with workers in lower income jobs often really needing to have greater control over their schedules that they often don't have. We're also thinking about the interpersonal relationships that I mentioned that can provide that source of connectedness at work, but may also be, on the flip side, possible sources of harassment or bullying or discrimination. So how can we begin to look at some of those factors? We may also, in looking at working conditions, want to look at issues around some of the current issues that happen with non-standard work. I think that during the pandemic, we began to see that the nature of work was actually changing. That many workers went home, started to work from their computers, and had a lot of interface with the Zoom meetings, and maybe the blurring of lines between their home and their work lives. Whereas other workers were the so-called essential workers who had a different experience during the pandemic. But many of those leftover conditions of work are still coloring the way we work today. And as we think about looking forward, how can we improve the working conditions? What are the policies and practices that need to be put into place to make a difference? We think about those policies on multiple levels. Certainly, we've got to start at the societal level. So, for example, policies that may matter may have a lot to do with minimum wage factors, for example. Minimum wage salaries were on the ballot in many states during this election, and I believe that it was actually passed in many places. We also know that in Massachusetts, there's a new family leave law that's in place that offers the opportunity for more workers to take a leave during either parental time or perhaps for older relatives. So some of these sort of societal factors can make a huge difference, but at the work organization level, there's a lot that can also happen, both in terms of policy and in terms of the practices that might actually be influencing worker health on a day-to-day basis. And as we go into many workplaces, what we try to look at is kind of a multi-level approach, starting with the role of senior managers who really set the stage for how work is organized, who have a vision for the organization, who understand how to communicate to employees around the nature of the value of worker health and well-being and how that matters in terms of how work is organized. Line managers also make a huge difference in terms of communicating that and being held accountable for making sure that, for example, breaks happen on time with a regular basis and that policies around breaks actually happen, or that schedules allow for rest in between shifts, natural things that clearly have an impact on well-being. And then finally, workers. Workers need a voice in the nature of their work environments. They, of all people, know what's best in terms of which are the parts of their work environment that really matter to their health and well-being. And hearing from them as we begin to plan for changes in working conditions really can make a difference. So I'm going to stop there. We'll hear more during the conversation, but thank you for a chance to make a few comments.
All right. This is my third panel for the School of Public Health, and every time they put me on right after lunch. And so I want to thank the school for the best position of the day to see if I can keep you awake as we go through this. And the other thing they like to do with me is to put me on with people who are doctor, and then there is just me, sort of work-a-day guy running a company up in Lawrence. So I do run a company up in Lawrence. We make high-quality promotional items, what you call swag. We're in all of your closets. We make it not only under our own brand, but brands like Samsonite and Osprey and Igloo and a whole bunch of other brands. We sell it to every company across the United States, and we decorate it up in Lawrence. And the stuff is built somewhere on the planet, generally not the United States, except for some igloo items. And so I work in a lot of different environments, whether it's somewhere in Asia, where I'll be next month in a bunch of different countries preparing for a new geopolitical environment, or up in Florence, where we're one of the largest employers up there. And they like to drag people like me to these conferences here at other institutions, because they walk around our plant and they see a bunch of happy people who want to be there, and they're trying to figure out what we're doing that's different than what everybody else is doing. And so I'll spend a little bit of time talking about that, but I'd rather spend more time answering questions, which I do anyway. Florence is a gateway community. Many of you know that. It's a very specific community. It's one of the questions they asked me was, how do you keep people engaged and happy in your organization? And what I do up in Florence for our line people who are up there, some of the stuff seems special up in Florence, but for example, my kids who all have advanced degrees from elite universities, and maybe for you, this might not be so special. It might be something that's expected. So what happens in an organization is very much context specific to that organization, to who it is, and to what the culture is. Our culture, beyond being a gateway community, we have a lot of Dominicans who work in the plant, and that is a very specific culture. I happen to love the culture. It's very friendly and warm and open. And they say things to me that would make some people's teeth drop out here. But I find it fun and endearing, and it has become a part of the culture. And I actually lean into it, because what I'm trying to do is to give people a sense of agency and belonging. Larry Summers once said that in the history of humanity, nobody ever washed a rented car. And so one of our goals is to make sure that our employees don't feel like they're working in the equivalent of a rented car. And the only way to do that is to give people agency. And there's a couple of ways to do that. One is they have to feel like they're being seen by myself and the other people in the company. There is this myth that is absolutely not true at our company, that I know everybody's name. Because if I know your name, I'll actually call you by name. I can't, I'm not that smart. I'm not that good. I don't have Bill Clinton's gift of knowing everybody's name, but I call people by their name as much as I can. And new employees say, oh, it's amazing that you know everybody's name. And I say, I don't know everybody's name, but they believe it. And that is super important, to be seen by somebody like me, the owner of the company. It's very important to them. And I know a bunch about a lot of them because I walk the plant floor a lot, and I can read their body language, even though I might not know everything that was going on. In fact, I had an employee about a month ago I walked up to. I said, what's the matter? And she said, do you think something's the matter with me? And I said, yeah, I do. And it turned out her dog had died, and she was very sad. And I could just read it on her face. And it was incredibly important. And I went to CHR and I said, Santa's dog died and she's very sad. Could you go help make her happier, do whatever the HR people do with their magic? And they did that. But that is really important to people, that they know that the owner is walking around and they know that I care about them and their well-being. The other thing that we do is we provide people a sense of agency through a whole bunch of different programs that we run. One is something simple like idea generation, where they gather around in a huddle and everybody, if something doesn't work, this is right out of the Toyota production system for those of you who are familiar with it. And they get to have an impact on their environment with no supervisor, manager, or anybody else stopping them from doing it. And we have this training program that allows the people who are really good to grow within the organization. So the people who are running the plant are people who came in with no marketable skills. When I say no marketable skills, they didn't speak English and they couldn't do much more than maybe open a box and move production from hither to yonder. And over time, we train them up. They have to learn English if they're really going to succeed. That is critically important. But the ones who are willing to work hard and are able to do it learn English, and they run the plant. And people see people who look like them growing. They see them learning. They see them having an impact, and they know they can do it also. It also works back to the family units because the kids see their parents get ahead. they want to study more, sometimes, not all the time, and boom, you can break the cycle of poverty. We actually had one of those people that I was talking about that came in with no skills. Their kid did an HR internship. She was in a four-year program, college program. She was going to be an HR professional, and she did a summer internship for us. I didn't realize she was this person's child when she came in to do the internship. But this is an opportunity. Everybody sees the opportunity to get ahead, no matter what you look like, what your background is, or what opportunities you may or may not have. So we tend to have a pretty engaged workforce. We ran 24/7 during COVID. We did a panel together during COVID, did a bunch of panels, and we were able to hire people because people in our organization told other people in the community that we would take care of them, and we did. I walk that plant every day, multiple times a day, because if it was safe enough for you, it's safe enough for me. And there's a lot of stories I can go into there, but we've found a lot of the happiness and engagement is around management engaging people as people and with people, and having those conversations people to people and not superior to subordinate. And with that, you can get people to engage pretty powerfully. The end.
Well, thank you both so much. I'm really looking forward to this conversation. And I guess my first question I'll phrase slightly differently to each of you. So for Jonathan, my question is, when you said you walked around the plant and you see a bunch of happy people, I wanted to know how you kind of define what it means to be a happy and engaged worker. And for Glorian, my question is, how would you define happiness, engagement, thriving at work? But why don't you get started?
So first of all, we survey people, and we have multiple surveys, employee surveys that we do that other organizations do in the best place to work. By the way, the Boston best place to work thing, if all of you see it, they charge you for it and they have no Spanish language survey. So if anybody here works for the Globe, you may want to bring them back to senior management there and see if you can get that changed. And then we have lots and lots of touch points for people in the organization. We don't close doors. People walk around. If you're a new employee, I will grab you and take you on a round where we'll walk around. And for some people, I'll say, hey, Carlos, are you happy today? Because it was one day I saw Carlos, and Carlos clearly wasn't happy. And I don't know what happened with Carlos. May have had a fight with his girlfriend or his wife or whatever he has. But if you see people every day, and I don't see people on third shift very much, frankly. We run 24/5. But I engage with as many people as I can, and I do rounds. I walk around the organization, and I talk to people, and I touch people, and I ask them, I get a hook with them about something, their dog, their hobby, their something. And I make a lot of fun of myself to try to narrow the distance between myself and them. I'm short, I'm fat, I'm balding. My wife clearly is very hard on me because there's a lot of jokes by me on these subjects to try to narrow the distance, because there is a gulf between myself and them. And I want to narrow it because I'm trying to build trust. And trust is one of our board members once said that trust is the basis of all relationships. And if I can get them to trust me, and this was especially important during COVID when I was trying to get them vaccinated, and we had 500 people, I got all but 6 vaccinated. And I would talk to them about their reproductive systems in ways that would make our HR team, their teeth would have fallen out. But I had to address the fears that they had in a way that made sense to them. And that was real, and that addressed what they were hearing on the radio. And I did it very clearly, and I built up trust over time from just being around. And that was really the critical piece. So that trust, I think, has allowed me to get a better sense of how people are doing. And there's a sense, I think, within the organization, this keeps coming back, that management cares, whatever that means. And it's true.
It's really exciting to hear what you're talking about in terms of sort of exemplifying management support, leadership commitment, the vision of sort of the importance of worker health and how it gets communicated in a very concrete way. I think it's just such an exciting way to hear about what you're describing, Jonathan. Jonathan describes how he can pick up on happiness or thriving on a one-on-one basis, sort of reading the sort of faces of people and understanding their day-to-day lives and understanding that culture, which is such a key piece of what it's about. From a research perspective, we look at it a little bit differently. We have to have something that's a standardized measure that can be used across different environments. And we've already talked about the fact that it varies from one organization to another. The work culture varies. The way that work is done, the nature of the work itself varies. So how do we then begin to describe thriving or happiness in the workplace, in a more generic kind of a way that we can actually measure? So that's actually something that we've done within our center, thankfully with funding from Happiness Center to develop a measure for thriving. And I was pulling through my papers here because I wanted to get the exact wording. So thriving, we describe thriving from work as a state of positive mental, physical, and social functioning that allows employees to achieve their full potential in their work, home, and community. And I wonder if is it okay if I ask Susan Peters, who's the principal investigator of this, to just describe our measure a little bit? And is it okay to kind of interrupt the panel? Yeah.
Hi, everyone. I'm Susan. I led a study that developed a measure of worker wellbeing, which is called the Thriving from Work Questionnaire, which was, as Glorian mentioned, was funded partially from the Center of Happiness. And what we have is kind of this conceptualization of thriving from work, which Glorian described. But we have these dimensions of thriving from work that we actually look at separately. So we look at them across different aspects. So we have a dimension that's called basic needs for thriving. So they're things like having fair pay, having access to leave to be able to care for your family. We look at social connection in the workplace, social well-being from work. So your ability to be supported in the workplace, to be respected and valued, your sense of belonging. We look at a dimension called psychological and emotional well-being from work. So that's where we kind of look at the meaning and purpose you get from your work and whether you're able to grow and learn and develop, like what Jonathan was describing in his workplace. We look at how work and life integrates together. So do you have balance between the two? Are there boundaries between the two? Conflict between how work might conflict with some of your family responsibilities? And we also look at just basic health and safety in the workplace. There's a concept called psychological safety, which many of you have probably heard about. We also look at physical safety and just the ability of being able to finish your day of work and not feel exhausted, and being able to give back to your family and some of the roles that you might have outside of work. So we're able to measure each of those dimensions as well as a kind of an overall kind of perspective of what thriving from work looks like. And we've translated into Spanish, as well as Haitian Creole, Portuguese, German, a bunch of European languages, and we're validated across many different industries and sectors. And we use this to measure well-being, as well as being able to use it as a framework to help identify some of the problem areas that might be existing in the workplace. So you can think about how you might actually put in place solutions or strategies to help kind of overcome some of those things that you might be seeing when you do a survey. So I'm going to hand it back to
Thank you, Susan. My next question is, so we have talked a lot about what it means to be happy at work and thriving at work. And I wanted to ask each of you what you feel like the major barriers are to achieving that kind of state of well-being, happiness, sense of belonging in the workplace.
Good, nice, easy question to go after that one. First of all, this is a job, and as you were talking, I was thinking about the meatpacking plant I went through a couple of months ago. And if we did that survey there, what would that look like, because it's just I don't know if any of you have been in the meat packing plant, but they're cold and they're messy. And it's just, for most people, it would be upset not to have them, and somebody has to work there, and it's a hard job, but it has to happen. So I think not every day, nobody's skipping to work every day. No, people have to work to make a living. So there are good days and bad days at work. And for us, I think one of the critical factors is, actually, let me tell you what the problem is, and then one of the critical responses are, we're seeing more issues around mental health than we've ever seen before. Some of it is drug-related issues. I have a relative who has a drug problem that I'm dealing with. And if you have a kid that's sick or that's addicted, it is with you all day, every minute of the day. You cannot escape it. And it's certainly true for our people. We're seeing issues, marriage issues, spousal issues, sometimes issues around spousal abuse that they're dealing with. And then what I'm hearing, and I see none of this firsthand, this goes to HR and they're very good at keeping it within their walls, is issues around depression. And it could be anything. So there's, one case I know, this gentleman, his wife is dying, and he's worried about her and he's worried about paying for the funeral. And that may be something that somebody here would worry about, maybe not, but it hangs heavily on him and everybody who knows him. And this is just part of life and what goes on. And I don't mean to be flippant about it, but we see these issues coming up. The mental health issues seem to be more recently, and I don't know really why. My guess is there's a general fraying of a sense of community, that if you look everywhere, we don't watch the same TV shows, we don't do the same things. There's people have retreated to their own universes where it's an us and a them, and the them is always bad. It almost feels like we've reverted 25,000 years to where the people living in the next cave are bad people and the people in our cave are good people, and we're going to, just be in our own little community. Our vision statement is that we promote community. We're in the promotions business. When you put a logo on something, it says Harvard School of Public Health, there's a sense of belonging, or whether it's you like horses or playing soccer, or whether you work at Merck next door, or whatever, there is a sense of belonging. But we also talk about the community inside and inside our walls, and that's all of our walls globally, and the communities in which we do business. And so we work really hard at building this sense of community within people. And it's a little bit like they say in the Army, once the shooting starts, you're not fighting for your country anymore, you're fighting for the person who's sitting next to you. And so we try to build the sense of pride. We talk about pride in people, pride in product, and we try to build this sense of community. And that's part of the reason that we walk around. And when we take customers around, they notice it because people look up. You said, how do you know that people are thriving? They look up, they make eye contact, and they smile. And sometimes they hurl crap my way in front of people that they don't know. And you got to be really comfortable to hurl crap at the owner in front of people that you don't know. And we work really hard on that to make sure that people are comfortable doing that, because that builds community, that sense of irreverence and belonging enough to feel comfortable to do that.
Those are all really good examples of sort of one of the key things that I think can be a barrier, which is that lack of leadership commitment, that lack of having the worker well-being tied to the mission of the organization. And I think the way you framed it is an excellent example of what's there in your company and what can be lacking and be a major barrier to not seeing improvements in worker well-being. I think we also look at very broadly context, and context can make a huge difference from one organization to the next. I want to give you a little example from a study that we did a few years ago where we had more barriers than I would like to even discuss, but a lot of it did have to do with context. We started out with very high level leadership commitment and support, but it was high level. And it didn't somehow get translated to the lower levels and the levels that workers were really experiencing. In addition, during the time we were there, the organization experienced major financial challenges that made a huge difference in the way that they could actually move forward on any changes that they were actually first talking about. So to try to actually reduce the workload or the work intensity was not really possible in the face of the challenges that they were facing. Not surprisingly, with those financial challenges came a lot of turnover. Well, turnover means not only you're missing this person who was doing the work, but it means you've got to invest in the next level of finding people who you can replace that person with and training them in and having that loss of continuity in terms of the vision that you were trying to create for that positive work environment. So context can matter in terms of a wide array of what's happening in the organization itself and what might be even happening externally. What are some of the things that might not be in the control of the work organization? For example, in this particular study, there was a subcontract. The work was subcontracted from another work organization. And the other organization actually owned the workspace. So that when we made recommendations, for example, for the work environment to change to be more safe or to be more supportive of worker health, it was not possible to make those changes because the larger organization that owned that space was not willing to do it. So I think one of the important pieces of planning for organizational change in order to promote worker safety and health is to do that initial assessment, to really talk to the different workers as well as managers to figure out what are the pain points, where are the potential challenges and barriers that one might actually anticipate, and to plan ahead for how to address some of those issues.
Thank you. And then this actually leads to a question I have for Jonathan, which is, as a leader, how do you identify what people value? How do you identify what people need out of their work to make them feel happy and valued and part of the organization and part of the team?
Oh, that's a good one. So first of all, I don't always. We operate as a team, and there are managers much closer to people who know. And in some ways, let me back up a step. I have an advantage that some other people don't have. I have worked in a bazillion different countries. I think I've worked in almost every country in Asia, from Japan over to the Gulf, except for like Laos and Bhutan. But you go through a country, I've been there, I've worked in Africa, I've worked in South America and Central America, a lot of Europe, a lot of different places. So I'm used to different cultures. And to me, it's normal. And that is an advantage from seeing a lot of different cultures and working in a lot of different cultures. And I use cultural interpreters wherever I am. I can't know what every culture wants and thinks because there's so many different cues. Even how people stand, how close people stand to one another is so different in different cultures, and the things that you can and can't say is so different in different cultures that I have to rely on trusted intermediaries to tell me when something's going right or going wrong. And I use them to figure out what's important in terms of how the information is delivered. But I think people understand what our goals are. And we've been very clear on what the cultural norms are within the company and what's acceptable and what's not. And I'll give you just one example. When one starts as a new employee, you end up going around and you meet people and you work in just about every different department for some amount of time. You end up in my office for 15 or 30 minutes, and I start and I say, tell me about yourself. Where were you born? We move forward there and I ask a bunch of questions. And then one of the things I tell them is, you're going to make mistakes, and that's absolutely fine. The only thing that's unforgivable is any issues around integrity. And just so you know, there are no second chances on integrity. Turns out the CEO, I'm actually the executive chair only, there's a person now who's the CEO, had been telling them something very similar. So they were getting that message twice. And nobody ever asked me, what does that mean by integrity? Never has anybody asked me, can you be more specific about that? And 3 times in my history, we've fired somebody for integrity. And generally, it's because they told us something that wasn't true. They were supposed to be here, but they were there. They told us they were here and they were gone the next morning because there is no second chance on integrity issues. Everybody knows that. You don't have to worry. Company runs clean. My wife told me she would never visit me in jail. Said, don't go to jail. I won't visit you there. I think she was serious. I'm taking her at her word. She also told me I can't afford to get divorced. I believe her on that too. Her mother cackled in the background, which was very disconcerting. But I plan not to get divorced and plan not to go to jail. I've found those to be sort of important things. And so if everybody knows that integrity is really important, however it's translated in the company, then you don't have to worry about what a cultural norm is. So there's lots of small stuff that happens around the company that translates what's important and what really isn't.
It's fantastic here. And I too hope that you do not go to jail. Sounds like you're pretty
My
safe.
wife would be so unhappy if she heard me tell that story. So please don't send this over to the School of Education or the medical school, please.
My next question, Glorian, I will start with you, is how have you seen the nature of work change in the past couple of years, both like leading up to the pandemic, but also during and post-pandemic? And what kind of implications do you think that that has for well-being and thriving at work?
I think that's a really important issue. And as we've looked at it, it's changing on so many different levels. I think we can even go back to societal norms or societal trends in terms of the flow of jobs, so that the nature of globalization has in many ways changed. It changes the work pace and the intensity of work because deadlines change and the nature of how that workflow happens. On a day-to-day basis, I think many people are experiencing changes in terms of where they work or how they work. How do we balance that sense of working from home for those knowledge workers or similar who are able to work from home? What does that look like? How do you balance the boundaries between work and family? How do you give yourself breaks between times, between Zoom calls, perhaps? And for people who are still not working from home, I think the nature of the kind of job market has changed with more people in delivery services, more different kinds of jobs that are actually in place, that as the work changes, we see evolving changes in terms of who's employed in what kinds of sectors. That also, I think, we see within the literature a growing concern around the role of artificial intelligence. We just had a meeting earlier today talking about the role of monitoring within work and the use of artificial intelligence in terms of monitoring. Maybe it's monitoring for efficiency, trying to keep track of where workers are. Maybe it's monitoring in terms of safety. But all of that has implications for workers whose mental health may be affected by that sense of being watched and controlled to a certain extent. So I think as we begin to look toward the future, there are certainly very exciting changes. We can, many people are benefiting from the fact that their place of residence doesn't always have to be tied to their place of employment. For many, that's really positive. But for other workers, there are many challenges that as we move into the future, we need to understand how to monitor those, understand how those different kinds of working experiences may have implications for mental health and well-being.
Can I address something that you just said? Because I don't know if you remember this on the panel that we did together during COVID. I said that all the academics are going to be wringing their hand in a few years at the inequality that's been driven by the ability of some people to work remotely and others who don't have that ability. And I think we're going to see that, but this work remotely thing is definitely a two-edged sword. in terms of fostering a sense of community and a sense of belonging and that whole rental car mentality. So that's one piece. The other piece is that we have been going through, and it's accelerating, a series of transformations that are pretty profound. And people always hang their hat on things like AI, which is super important on a number of different fronts. But in every city in the United States today, there's a screen printer. If you played soccer, you have kids that played soccer or baseball or whatever the hell they played, they get their t-shirts or their stuff from the local screen printer. That business is going to digitize and get disrupted. And I have no idea what's going to happen to that, but people have been printing on stuff since the Egyptians printed on papyrus. And that whole business is going to turn digital. And what happens to all these people across the country who are working on these businesses? And if you want to see the manifestation of this today, Fanatics would not exist as a company without this digitization. And this is just increasing. So what are you going to do for the people in these industries that are going to get disrupted? And for the people who don't have degrees from elite institutions, we're going to have to teach them how to learn if they don't already know. And when people walk through the plant, one of the things I say to them is, none of these people are stupid. They just didn't have the opportunity that you had. And so different backgrounds, whatever, and you see the cream rise to the top in whatever it is that they're good at. If you put a gun to my head and said, cut an arc on this piece of wood like this, toast, I'm gone. But I have people who are doing in their head somewhere a complex mathematical calculation that allows them to look at it and go, yeah, zoop, and do it like that. And we've seen all sorts of other stuff. That's just one bad example of that. But there's all these skills that people have, but the skill that they need the most is this ability to learn how to learn. And that's the core of the system that we teach them. Starting with idea generation, which is really about giving them agency, teaching them to learn, and then vacuuming out these good ideas and getting them to create a sense of belonging for themselves and the other people who work there.
In your view, in your observation, I guess in your organization and elsewhere, have you seen the way that people think about well-being at work shift during this time?
It was certainly different during COVID, and that was one example. But what I would say today is that a lot of things are a two-edged sword. So you talk about the Family Leave Act. That thing is a bear if you're an employer. It is not everybody treats it as it should be treated, and it gets abused. And I hear other manufacturing companies talk about this, and it makes it very difficult. And Massachusetts is different than other states. And by the way, there's a view in the manufacturing community that Massachusetts itself does not like manufacturing, that it wants it to go somewhere else. And so people do. I think it's partly because you have people with good intentions trying to do things that doesn't really jive with the real world. In my world, what we have, we're dealing with the current mental health crisis of the country. And we're in one giant mental health crisis right now. And you see it manifested everywhere in the workplace. Any of you have been in an emergency room recently? It's full of people in crisis who have no place to go. And I'm going to go back to what I've been saying for the last hour, which is we try to provide a sense of community to people so that they have people to talk to, whether it's HR, whether it's their friend, whether it's outside of work, they're together. That's all we can do. What I guess the difference we're seeing is that it's more intense today than it was before, but I think everything is more intense. And I think social media has done enormous amount of damage to the world. I'm not sure it's been, I hope they don't see this. I'm going to lose some customers. But I'm not sure this is going to be seen as a great force for good at the end of the day. And so keeping people from doom scrolling, especially, wherever you were on the election, I suspect I know where this room was. it is a important thing if you can do it, but that's really out of our control. So not a great answer, but I think everything's just more intense than it was before.
Glorian, what about you in your observation? How has the way that we think about well-being or work health at work been shifting?
I think that Jonathan makes a really good point that there is a new crisis in terms of mental health, and it's something we see. All you have to do is look at the news, and you see that it's an increasing commonality, the concern about loneliness, how loneliness even in the workplace happens because people go to work and they don't feel that sense of social connectedness that you're talking about in your company trying to build. That sense that that there are these larger forces out there that are not contributing to a sense of communal well-being. And we all know that that sense of communal connectedness and well-being matters. You know, do you feel connected in your own little neighborhood? Even that can make a huge difference. And I do think the political divides among us are making it more challenging. What does that mean in terms of what people experience? I think we hear so much, I think in our world of research, that burnout is going up, that people are leaving jobs. We see this particularly, I think, in the healthcare area, that people are feeling burned out, that they can't manage anymore, and that people are leaving the field. And that it might mean that as a consequence, those people who are sort of left standing are the ones who may really also be challenged because more work is falling on the remaining workers. So I think understanding the social dynamics of sort of the mental health crisis overall and what it means for the workers who are encountering it and what different sources of stress in our lives makes a huge difference. And we don't separate it from the workplace. We bring that into the workplace, and it becomes part of our social interactions.
And, you know, as both of you have been talking, particularly Jonathan, as you've been sort of describing your own leadership style and how effective it is, it strikes me that it's very rare to have someone who approaches leadership and work and well-being the way that you do, which is, again, why Harvard keeps bringing you back to talk about this. And I was wondering if you had thought at all about why more people don't do what you do.
I think there are more people, you just don't know how to find them. So today I sent a note at lunchtime to a friend of mine. His son is taking over their family business. I think he's 7th generation that's taking over that business. And we had a mutual friend whose business was founded in 1842. And it went through one family in this business. And I remember him sitting there and talking about stewardship. I mean, he said, stewardship, he viewed his job as to move the business to the next generation, which can be very good or very bad, because family businesses can be complicated. And I have no family members in my business, but they can be complicated. I'm lucky. I have no limited partners. So we're not owned by private equity, and I don't particularly have a problem with private equity. I like doing my own thing. And my family's fine. We don't need to vacuum the last nickel off the table. And my family would probably be upset if we did. And so I'm able to do things the way I want. And this is what I prefer. And there's a bunch of other people who are the same way. This is a really hard thing to do. I mean, they may not teach this at the School of Public Health, but people are freaking complicated. And you don't always know what's going on. And sometimes you also say stupid things, even when you don't mean to. And, it's just managing people is super hard, especially in today's environment. And I have a friend of mine, his family business is close to $4 billion. And he was walking around my plant, and he's a great guy. They're very philanthropic. He's engaged in the business. But he can't know everybody's name. He's got thousands and thousands and thousands of employees. And it's just hard. So I think there's a lot of people who try hard. If you really quickly, if you look at what happens to what happened to the car companies, management thought the union was trying to screw them. The union thought management was trying to screw them, and they were both right. And Toyota came along with a system that empowered workers and ate their lunch. And it was unnecessary because there were really good people in both management and on the line working in these companies. And so for us, it's a matter of survival, that there's plenty of people who would love to see us go out of business. And what I tell people is if we have a hole on this side of the boat or that side of the boat, in your department or my department, it doesn't matter. The outlook for the boat is the same. And so we have to figure out how to work together to get it done. And so this is it's partly me and the way I like working, but it's also a matter of survival. If everybody's not energized and we have a hell of a lot of challenges, then we're going to be toast.
So I imagine that many people in the audience also have questions. So I think at this time, we're going to turn it over to you all. And if you just raise your hands, Karina will come over with a microphone so that you can ask.
Thank you very much. This was a great panel. I want to build on that comment because I would like to ask you, what are the arguments you would have if you have somebody across the table? And Professor Sorensen, you said everybody cares about well-being. I feel a lot of the time in the workplace when there's so much of pressure and everything is about profit, people think about their own well-being, or we think about our own, but not about our colleagues. So what are the arguments you would use to convince somebody maybe to invest, whether it's a CEO or whether it's a head of department, to think more of the well-being of the staff or of the team? And what are the concrete advice that you could give that could be used as a sort of a guideline for somebody leading an organization? Thank you.
I'm sorry if I communicated that I thought everybody cared about well-being. I didn't mean to communicate that. I think you're right that many people don't. But I think the reality is that the performance of the work organization can benefit from an attention to worker well-being. And I actually want to read you one quote because I actually have been working with a colleague who is, see if I can find her quote. I've been working with a colleague, the head of the work organization, the work psychology for Novo Nordisk, a large global international company that is actually rated as the employer of preference within the country of Denmark. And their CEO was quoted in just recently, in March this year, in Fortune magazine of saying, "I don't think you can run a company if more than 10% of workers are suffering from stress. We make sure to educate leaders on what does it mean to mitigate stress." That sense of worker, of the CEO really communicating that vision really matters. Well, why does it matter? It matters in terms of a range of outcomes. It matters in terms of, there's a significant literature around creating that healthy work environment. It matters for turnover. It matters for sickness absence. It makes a difference in terms of client satisfaction and outcomes in terms of interactions between workers and clients. It lowers healthcare costs, is associated with lower healthcare costs because workers are have a greater sense of well-being, and they may actually be more able to take care of themselves and their own health. As we've seen from the conversation from Jonathan, I think it matters in terms of worker engagement. That sense of agency and having a voice within your own work environment means that people are going to be more connected to the work environment. And we know that that cost of turnover can be huge. So I think there's a wide array of outcomes that can really matter, and that there's a large literature around this that we can really point to. So I think there are certainly barriers, the barriers that we've talked about, that really can get in the way. But I do think that there are a lot of benefits that many organizations experience that means that they're going to commit to creating that healthy work environment, not just because they're altruistic and think it's a good thing to do, but because they know that it in fact influences the performance of the organization.
Can I also say that we talk about things like there's one uniform industry out there. If I go work in finance, I know I'm going to have intense people who are very profit motivated. I go into that business knowing that. If I'm working at Children's Hospital or Dana-Farber, I'm driven by a sense of mission, and that may be quite different. And so I may get attracted to a specific industry because I'm looking for something personally. And the profit motive is very good. You know, it always drives me bonkers when politicians talk about the millionaires and the billionaires. It shouldn't be that we're going to take from them. It should be that we're going to lift everybody up, because people have to be motivated. There has to be some motivation, you know, and we have a way of doing it within our organization where everybody has the potential to get a bonus. And that's very motivational for people. But it's not the prime motivation, I think, for most of them. It's a secondary motivation. I'm sure you've done a ton of research on financial versus other motivations, but it's very different based on what industry that you go into. And this is about lifting all boats.
Hands up. We're here.
Oh, I'm sorry. Thank you so much, both of you, Dr. Sorensen and Mr. Isaacson, for your comments. I work primarily in the community of Lawrence, and we have been seeing the whole piece around mental health unfold, particularly post-COVID. And so I wondered, for both of you, what do you say to community partners who might be able to support what you're seeing in workplaces with employees in terms of whatever challenges they might be going through? Is there a way that you're connecting with outside partners, or is your work all internal?
I think this is aimed at me. We're very engaged in the community, both financially and in terms of working with community organizations. And there's, I don't know which organization you're affiliated with, but we've worked with a ton of them. My personal interest, and therefore the company's interest, is really around children and education and trying to give people a leg up. So organizations like the Boys and Girls Club in Lawrence, which does amazing work and did incredible work during COVID, we're a huge supporter. And I could start naming off organizations. I'll actually just name one more and then I'll stop there. There's this group called Elevate New England, which takes kids on the bubble in the Lawrence school system. And it sounds almost kind of goofy, but it teaches them how to make good decisions. And it's something like 95% of these kids get through high school and get into a job, the military, a 2-year program or a 4-year program. And they have somebody who looks like them working with the kids, and they follow them all the way through, and they do some really amazing work. There's an enormous amount of community institutions that do great work in Lawrence. Our view is that our community doesn't work unless the community of Lawrence works. And you know that Lawrence is a very complicated place, a very complicated place. So we do our best, but we're one organization. And I will tell you, it's much harder to raise philanthropic dollars in Lawrence than it is in Boston, because getting your name in granite in Lawrence is much less interesting to a lot of wealthy donors than it is in a place that may be around here somewhere that may rhyme with Barvard. And so, you know, it's much less interesting, I think, for some people to tell their friends they're invested in Lawrence. You can do a lot more good with a lot less funds up there. For people who really deserve it. You just have to convince people. Also, the capacity for people to know how to raise money is really not very good in the city, as you probably know. So there's a bunch of structural issues up in Lawrence, but we engage with the community on 1,000 different levels.
Hello. My name is Ash. My question for any one of you, something that is really troubling me is when it comes to behavioral health workforce, it's the biggest challenge to retain workforce and make sure that they are paid adequately. So while I was working in Connecticut, I took my partner's car for servicing, and he owns a Mustang that is pretty expensive. But the cost of the labor was $200 per hour. And that kind of blew my mind. For me to get there to have that kind of rate for my own services, I would take like 10 years. So I see a very slow growth in like behavioral health workforce when it comes to costing inflation into salaries, like the cost of living, the COLA. While in IT sector, my friends can like earn in like 5 years, they reach a mark which would take 10 years for me. And I think that is the biggest challenge to retain workforce, especially in the behavioral health space. Like people have to often do 3 jobs to make sure that they meet ends and they are providing therapy. So do you take inflation in account at your organization? And how can this space, the healthcare space, also learn something from it? Yeah. So also to back it up, in Connecticut, there was a study done last year where the rate of interest, the rate of workforce was taken into account, and it reflected that of 2007. So since 2007, COLA was not taken into account when workforce was reimbursed. So yeah.
I don't think there needs to be a comment. I think you've said it exactly. And what you're raising is a huge issue. Absolutely. There's a huge gap in terms of salaries paid for people who are working in many of these fields, whether we're talking about behavioral health or home health aides or substance abuse providers or any kind of these, caregiving fields are so undervalued by the monetary investments that we are as a society making. And I think that it means, just as you're saying, that people have to have multiple jobs, or that there's an instability in the employment because people may be looking for a place that pays a little bit better, understandably. So I think you're raising a very important point, and I don't think I have a solution. But maybe Erika or Jonathan wants to add.
If I had that solution, I'd be in a completely different job than I am now. If you can throw a ball really, really well, you can make $1 bazillion. I mean, how things are valued, I can't figure out. My wife graduated from the Harvard Ed School. I have a daughter at the medical school and who graduated, and a son at the business school. You want to figure out what the tiering is in terms of salaries? I mean, it makes no sense, but this is what it is. I don't know that there's an answer. I certainly don't have one.
Hi, greetings. My name is Imam Abdul Qadir Farah. I'm Sister Suad, who's next to me, and we're from the Islamic Society of Boston in Roxbury, Massachusetts. We have another location in near Harvard Square as well. So we kind of serve both the affluent and the very, underserved communities. So one thing I want to say is a comment, and also I have a question. So the comment is that one of the things that I, as an imam, serve in different communities, people from different backgrounds. We have in our mosque, we have about 90 different nationalities. So one of the things that I thought works for us is to listen to everybody, just listen to what they have to say, and basically just show yourself that you are there for them and that you agree with them. And that's basically one of the things that you could do if you work in these sort of like different environments in order to support people and workers and different people. But the question I have has to do with, because I know this is well-being, and also, because we're talking about workspace, especially when we have, and probably maybe this question is for Jonathan. When you are running a company, that the company, the main goal of a company, of course, it's the idea to make profit. So how do you combine the idea of making profit versus caring for the well-being of those who work for you?
They're not mutually exclusive. Everybody knows we have to make a profit. But we don't have to vacuum every nickel off the table. There can be something for the people who are there. We operate within certain economic constraints. We are not Google. We're not Microsoft. We don't pay like Google and Microsoft pay. We operate the best we can in the environment that we're in. But for us, if we want people to engage, they have to feel like they're not being screwed. And they have to, it goes back to the Larry Summers thing. You know, if it feels like a rental car, then all sorts of bad things are going to happen. I was talking to somebody earlier, and I said I was standing in a factory in Sri Lanka. It's a much longer story. And I had this idea that happy people make happy products. I came to that conclusion standing there. And it is true that you watch somebody looking at a product and they're not paid more if that product looks good that they can see. I mean, there is an indirect benefit to them, but you can see the pride in what they're putting out. And so it's incumbent upon us as the managers to build that pride so that they serve the customers. And through that, we can give more back into our own community. It is a virtuous cycle at the end of the day.
That feels like a pretty hopeful place to end. So we are exactly at time. So thank you both so much for your contributions and the audience too. And I think that closes this session. Thank you again.
Thank you all for providing your expertise on how we can create healthy workspaces and encourage inclusive, collaborative work environments. One more round of applause for our moderators and panelists. With that, we have completed all 3 of our panels. Let's have one more round of applause for all of our panelists and moderators. Thank you so much for helping make this inaugural Chester Pierce Symposium so wonderful. To conclude our inaugural Chester Pierce Symposium, we will have closing remarks from the director of the Lee Kum-Shung Center for Health and Happiness, Dr. Vish Viswanath. In addition to being center director, he serves many additional roles in our community. Dr. Viswanath's award-winning work is centered on understanding communication inequalities to promote positive health behavior. Contributing to this symposium has been an honor, and I would like us all to give thanks to him and his team with a big round of applause, just one more, as we welcome Dr. Viswanath back to the stage. Thank you so much.
Actually, Emry is a hero of the day. Please give him another. So I was joking with somebody. Someone asked him, I think, Glorian, what's your association with the center? You know, Emry doesn't have a formal association, but for every seminar we held for the last, Emry was the first person to show up. Every seminar, attended every seminar with every meeting, luncheon meeting with us. And it's been an amazing, amazing player and participant in the center. So thank you, Emry. You did a fabulous job. Thank you so much for what you did. And hopefully you'll continue to hang around Boston so that we can continue to engage. As always, as I said this morning, and I'll continue to repeat it, some of you get tired of this, as running a center for happiness, I have to start and end with gratitude. So once again, some of you are not here, so I want to make sure that I express my gratitude. Start this conversation thanking the Lee family, which has endowed our center, which makes these things possible. It's very interesting. I have said this before. Lee family doesn't have anything to do with Harvard. They have no connection to Harvard. But through a variety of conditions, circumstances, they decided to fund the center at the school. And we have been able to do a number of interesting things, including symposia such as this, So I want to thank them and acknowledge their support, and definitely thank the panelists and speakers. It's amazing, the collection of people we managed to get together and bring together, rather. As I said this morning, we thought a lot about in our internal huddles, what kind of speakers do we want, and panelists, and we had a great, intentionally and deliberately, we had a great mix of scholars, researchers, practitioners, activists, organizers, together to engage in this conversation and dialogue. And so you saw the entire day was amazingly instructive in many ways and stimulating. So thank you all. I know you're all busy people, but thanks for coming and sharing your thoughts with us. And to the audience, you have been very patient, including some of my team members in the peanut gallery there, and others who have been here throughout the day and engaged in this in the dialogue with us, and the leadership of the school, which has supported us, and of course my team for the center. Again, they're all in the last row. I don't know who is missing, maybe someone at the registration desk. I see Karina, Naomi, Ayla, Anubha. If I'm missing someone else, please forgive me. As I said, I don't know how much work they have put in. Every time you should see my inbox and the fur review folder. They don't trust me, number one, I should tell you. So they have this, see, even now they don't trust me. They have this 5-minute sign, Thank you, Naomi. I really appreciate it. You should see the documents they create for me, make sure that I'm staying and walking through the right way. And I'm sure I'll hear from them if I made some mistakes, So yesterday was technically a holiday for the school, but yet they all were working to pull this off. So I can't thank you enough for all the work you did. Thank you. They deserve a big round of applause along with Emry. Given the warning from Naomi, I won't go through every speaker and panelist remarks, but I just wanted to highlight 3 or 4 things that repeatedly came up today through the panelists and the conversations. And of course, Ayla will be upset with me because she has taken detailed notes on everybody and sent it to me to make sure that I cover all of them. Ayla, you'll have to stay the entire evening if I cover all the wonderful notes you sent. One thing that came up is the issue of race and inequities. I think in virtually every conversation we had today, we can talk about resilience and we can talk about mitigating, reinforcing, and addressing and promoting resilience. But foundational to this issue is inequity, and closely connected to this is the issue of racism. And I think, and the interesting thing, I just wanted to highlight it because not everyone was here this morning for the first couple of panels. It's just not the interpersonal racism that was discussed today. It's this kind of a systemic racism, structural racism, continuously drawing attention to the social conditions and social structure, that leads to these types of discrimination and how that affects issues of resilience. I think, that's an important point. And as we go forward in thinking of addressing this, thinking about structural racism and how to address it is very critical with close alignment with whatever you want to call it, social class, socioeconomic status, issues of poverty, etc. And so that's one that repeatedly came up. Other is systems versus individual. It's very, very interesting. I think even when we talked about individual definitions of resilience and what resilience at the individual level, almost every panelist drew attention to the social conditions and the systems that shape those individual behaviors and biology, and that interaction between individuals and systems, and how we have to address those systemic issues if we were to build resilience and help people cope with adversity. So I think that's another theme that came up continuously. Engagement, community engagement. As someone who does community engaged research, who has been doing this for 20 years, my community partners are right here with me. For 20 years, we have been working with Alicia and Martha and others in Lawrence. And everybody, virtually everyone, talked about community engaged research. In essence, talking about engagement of stakeholders. So we have to bring we can't talk in a way in a top-down approach, but work with the people about whom we care. And I think that again is a running theme that emerged throughout the day. Issues of social connections and loneliness. I think this is a huge crisis. As you know, our center has last year's seminar theme was on loneliness. And we are trying to address it in a variety of ways. We have, as has been announced, has been stated, we have podcasts now. We are thinking of different ways of translating the science to reach different groups. And so hopefully we will be able to do that, to really promote idea of social connections and mitigating and addressing loneliness. And a lot of other issues have come out. I won't go through all of them, because of lack of time, and also I'm a little scared of Naomi's placards coming up. But seriously, I think one issue is that of technology that we haven't spent a lot of time. Glorian, you began that conversation on AI. As someone who also studies social media and new communication technologies, one thing that we haven't talked about today is this, sense of belonging has come up, sense of commonweal and community, sense of community has come up. But that sense of community is under constant threat because we don't share it anymore. We don't share the same reality. Your news feed is very different from my news. Right? So how can we build that sense of commonness and community, when our worlds of information are so different? Or as we say, we have been talking about this in our work recently on misinformation. Our information repertoires or news repertoires are very, very different from each other. So what do we share in common? So we have to work harder than ever, to build that sense of commonality and community and commonweal as we go forward in addressing issues around resilience. We started this conversation all those many months ago. We were discussing the theme for this. These social adversities do not disappear, whether it's racism, climate change, migration. Breaks your heart when you start thinking about it. Those won't disappear. I think what will matter is our response. How do we individually and collectively respond to that and build that sense of commonweal? I think that's where the answer lies. So I want to again thank everyone for this. Thank my team. Thank the audience. Thank the audience on the cyberspace online who have been attending very patiently. And you will just follow us on our center. And if I don't say this, I will be in trouble with Ayla on Twitter, social media, right, Ayla? So everywhere, So and you will hear more about us and more from us as we develop on these themes. Thank you. And we have a reception, so feel free to stop by and say hello to you. Thanks again.